Good evening, everyone. We are humbled to welcome you all once again on this platform. Our Team Ayurapta presents Rukshitha National Seminar with paper and poster presentation. And here we are going to begin the presentation today onwards. And first of all, I feel greatly honored to invite our panel members. So without further ado, let's jump into the presentation. And I wish all the very best to our participants. And dear participants, the panel strictly reminds the duration of your presentation. The maximum time allotted for your presentation is 8 minutes. So kindly do follow the time limit. And first we have a paper presentation. And I invite Dr. Ashwini Ankush. I invite Dr. Ashwini.
Yes, ma'am. Hello, good evening, ma'am.
Good evening, doctor.
Can we start our presentation, ma'am?
Yes, doctor.
Yes,
Please start.
doctor, please.
Okay. Okay, 1 minute.
Your screen is visible, doctor. Please start.
Okay, thank you. Hello, doctors. Good evening to all. Myself, Dr. Ashwini Ankush Zanzad, PG second year scholar from Kaichikitsa Department of Ashwin Rural Ayurved College, Sangamner. My guide name is Professor Sanjeev Lokhande, sir. My paper presentation topic name is Study of Effect of Sandhavadi Churna in Purusha Janaha with special reference to functional constipation. First slide, abstract. The aim of Ayurveda is to maintain health of individual and to eradicate disease like every other science of Ayurveda. Ayurveda is based on its own fundamental principle. For further advancement and evolution of any science, timely assessment and evolution of its principle by repeated application and verification is essential. After analyzing the Samhita Granthas, it becomes evident that since every beginning of research in the field of Ayurveda, ancient scholars, that is Maharushi, have tried their level best to explain and explore this principle. Second slide, introduction. Anaha means obstruction in the normal passage of vita, that is fetal matter, mutra, that is urine, and adovata, that is flatulence, which can be caused by various factors. Hence, the phrase Purusha Janaha means obstruction caused to excretion of malus or distension of abdomen caused by accumulation of fecal matter leading to difficulty for normal excretion of urine, flatus, or fecal matter from human body. Anaha can be of various type depending on factor causing the obstruction. Purusha Janaha is one of the type of anaha. Anaha is explained as a constipation. According to modern science, constipation is defined as a delay or difficulty in defecation due to hardened feces present for 2 or more weeks and enough to cause the significant distress to the patient. Functional constipation is one of the type of constipation. A recent systemic review found that the median functional constipation is very common in children nowadays because of many causes like changes in food habit due to fast food, improper diet, or improper toilet training, changing in sleep pattern, etc. Then prevalence of this and need of this study for Purusha Janaha, that is functional constipation. There are many treatments in modern science. Nowadays, large number of children suffer from functional constipation. A recent systemic review found that the median prevalence of constipation in children was 12%, looking on the different treatment and their complication available on the constipation. We must find effective and easy treatment for constipation, but in comparison, there are very few formulations nowadays using for Purusha Janaha by a current practitioner, where our Ayurvedic Samhita have given us a bulk of knowledge in which many good formulations are there in on Purusha Janaha, which are yet to be tested. One of those are the Sandhavadi Churna, which having the properties as the Deepan Pachan, Anuloman Rochan, Shula Prashaman, which help to cure the Purusha Janaha. The date of Till the date, no study has been conducted on Sandhavadi Churna. Hence, it decided to take a study. Aim of this my topic is to evaluate the efficacy of Sandhavadi Churna in Purusha Janaha. Objective is to study the Purusha Janaha according to Ayurveda. Review of literature of my study. Functional constipation has a prevalence worldwide. Hence, a scientific research is needed for its detailed evaluation. Sandhavadi Churna, with its probable mode of action, will be effective on functional constipation, but no previous work has done on this topic. Then previous work done, Bhandari Vishal Prakash clinical study on the efficacy of Aragvat Fal Majja Churna in Purusha Janaha with special reference to functional constipation, MUHS. Then Maiti Swagat clinical study of Purusha Janaha and its treatment with Krishna Trivrutta and Jangi Harit ki functional constipation has its prevalence worldwide, hence scientific research is needed for its detailed evaluation. Sandhavadi Churna, with its probable mode of action, will be effective on the functional constipation, but no previous work has been done on this topic. So fill up the existing knowledge gap, we concluded to work on it. Then disease review. Ayurveda Samhita, according to Bhav Prakash definition, Anahav is ama, that is undigested food, or the Shakrudra, that is feces, gradually accumulating inside the alimentary canal and obstructed from the going out by the aggravated vata and not coming out in their own roots upward from ama, downwards from purusha. This condition known as a anahav. Then selection criteria or study subject or eligibility criteria for my study is inclusive criteria is subject having age group of 15 to 12 years, selected irrespective of gender, the religion, or with the following criteria. Here we take a group of 5 to 12 years because functional constipation is common in the children. Patient presenting with the sign and symptom of Purusha Janaha, then who sign the informed consent are the inclusive criteria. Exclusive criteria are known case of other organic disorder, that is Hirschsprung disease. That is Hirschsprung disease means a condition of large intestine colon that causes difficulty in passing the stool. The known case of other systemic illness like TB, HIV, etc. Known case of hormonal disorder like hypothyroidism. Withdrawal criteria is if patient develop any adverse effect, if patient not responding to treatment, children not on a regular follow. Method of preparation of Sandhavadi Churna. According to Charanga Samhita, detailed description on the Churna Kalpana is mentioned. First, very dry dravyas like Sandhav, Shunda, Ela, Hingu, and Bharangi are grinded finely and filtered through the minute cloth called as a churna. Drug administration detail. Dose will calculated by dealing formula. That is matra is age is equal to matra is equal to age in years divided by 20 into adult matra. Material and methods. The material is collected from the classical text of Ayurveda Samhita modern literature, previous research work done, and journal. Then clinical feature. Clinical features of this study is Purusha's apravrutti, that is not passing the stool, Udarshul, pain in abdomen, Sashula malapravrutti, that is pain during the defecation, Vata apavartan, that is not passing the platters. Then Kati Purusha Shul, that is pain and back and waist, Shuddha, that is loss of appetite. Study instrument is spoon and stirrer. Data management and analysis observation as per symptom will be noted before and after the clinical trials. Interpretation will be based on any statistical test like paired, unpaired Z test, Man-Whitney U test, Wilcoxon rank sum test. Statistical analysis will be done with various graph, diagram, and chart table and observation. Discussion on the basis of collected data obtained for the statistical test, that is Wilcoxon sign rank test or Z test, will be applied and result will be done. Conclusion from the collected data, conclusion will be drawn. Randomization, simple random method. Binding is open study. References is Brahma Shankar Mishra and Sri Rupavalli Vaishya Bhavprakash Samhita 10th edition. चौखुंबा संस्कृत संस्थान वाराणसी पार्ट सेकेंड मध्यम खंड अध्याय नंबर 31 पेज नंबर 334 और by second reference of this study is चरक संहिता reprint in 2009 चौखुंबा संस्कृत प्रकाशन संस्थान अध्याय 20 पेज नंबर 390. Third reference of this study is चरक संहिता reprint in 2009 चौखुंबा संस्कृत प्रकाशन सूत्र स्थान अध्याय नंबर 7 पेज नंबर 164. Reference number 4 ब्रह्मानंद त्रिपाठी चरक संहिता reprint in 2009 चौखुंबा प्रकाशन इंद्रिय स्थान अध्याय नंबर 6 पेज नंबर 1016. Fifth reference is Andhram Samhita, Shushruta Samhita, first edition in 2001, Varanasi volume 3rd, Uttar Sthan Adhyay, number 51, page number 421. Then sixth reference is Hariprasad Tripathi, Vangasen Samhita in 2009, reprinted Chokhumba Prakashan Varanasi, Adhyay number 67, page number 6763. Then by Nepal Bajguru Pandit Hemaraj Sarma or the Sri Satyapal Vaishacharya Kashyap Samhita, reprint in 2016, Sutrasthan Adhyay 25, page number 50. Or eighth reference of this study is Anna Moreshwar Kunde Ashtanga Hruday, reprint in 2012, Shudrasthan Academy Prakashan Varanasi, Adhyay number 11, page number 512. Thank you for listening me silently.
Thank you, doctor.
Thank you, sir.
Thank you, doctor.
Dr. Ashini, are
So
you
next I
ready to
invite
present poster?
Dr. Prajakta Bua Sahib Jadhav.
Yes, ma'am.
So yes, my poster presentation is remaining. Hello.
Okay, doctor. Dr. Ashini,
Okay,
we will
doctor.
call you next, doctor. Next, I invite Dr. Prajakta. Dr. Prajakta, please share the screen, doctor. Hello, Dr. Prajakta.
Yes, sir. Hello, sir.
Hello, doctor. Please share the screen,
Yes,
doctor.
doctor, you're audible.
I'm Dr. Prajakta Jadhav, Kai Chikitsa Department. I'm audible, ma'am.
Yes, doctor, please continue.
My topic name is Agni Mandya and it's Ayurved management. Agni is a unique concept explained by Ayurveda, various concepts and types of Agni.
Hello, doctor. Your screen is not visible, doctor. Doctor, you have any problem with screen sharing, doctor?
Yes.
Okay, 1 minute, doctor. Okay, please continue, doctor. Screen is visible, doctor?
Yes.
Okay, please continue, doctor.
Agni is a unique concept explained by Ayurveda. Various concepts and types of Agni are mentioned regarding Agni's Ayurveda is maintained. The health state of mind and body of person. Any disorder in Agni lead to cause disease in person. To maintain the good health, various management has been done, including conservative treatment, Panchakarma, Bruhan, Langan, etc. Disorder in Agni causes Agni Mandya, Ajirna, etc. In Ayurveda, 13 types of Agni are explained, which are further classified in Dhattvagni, Bhutagni, and Jataragni. As compared to modern medicine, we can relate Agni with various enzymes active in body, which causes deepen pachan. Agni maintain the healthy state of body. As we know, it means as change in Agni causes disorder in body, which further causes disease. To keep the Agni in its normal state, we have to follow Ayurveda, and Ayurveda have mentioned various management to maintain the normal Agni for long life of individual. Today, we live in the era of 21st century and life is so fast and stressful that one can easily neglect his or her own health and fall sick, due to which rise to the concept of sedentary lifestyle diseases. Here, many major diseases fall in this category. Diabetes, hypertension are well-known threats in the society. Obesity, malabsorption syndrome, osteoporosis, etc., which reduces the life expectancy. Importance of Agni. Individual आयु वर्णा बला स्वास्थ्य upachaya prabha oj all these bhava depend upon Agni. Agni is the backbone of health. If one Agni is good, he is hardly diseased. Agni influences metabolism of all systems in body. All dhatu, dosha and mala are in well balance when Agni is in proper state. But if by any means Agni doesn't remain at its best, all equilibrium is lost and body inner environment gets filled by which is the sole causes of all diseases. Loss of appetite is a fairly common complaint in clinical practice. Its etiology is often vague and varies from diverse causes such as improper eating habit, prolonged debit illness to purely psychological disturbances as depression. Types of ajirna. Ajirna is classified in three types. Amajirna, abnormal kapha dosha. Vidagdha ajirna, abnormal pitta dosha. Vishabda ajirna, abnormal vata dosha. Causes of Agni-mandya. Causes of stress, worry, fear, anger, eating very dry, oily, heavy meals, eating junk food, suppression of natural urges, excessive drinking of fluids, drinking tea and caffeinated drinks. Sanprapti, as we know that Agniman is main step occurring in pathogenesis of many diseases. Here, Hetu 7 causes dosh prakop. This prakop pitta dosha, vetitis, dushanda there, samurchana, which leads to many diseases. Mostly it starts with Agni Mandya. Due to decreases in intensity of Agni, the अपचित्र रस produced leads to strotonanda amanirmiti. Hence, while treating any diseases, samprapti sampraptibhanga ways to the start with amachan, ampachan, agni Agni were the chikitsa to get the fast and complete cure from the disease. निदान, त्रुदोष प्रकोप, अग्निवैगुण्य, आमनिर्मिती, स्रोतस्रोत, अग्निमांद्य. Symptoms of Agnimandya. It is characterized by loss of appetite, loss of taste, weakness, indigestion, excessive salivation, sore irritation, heaviness of stomach and head, etc. Headache and myalgia, indigestion, loss of appetite, difficulty in digestion, pain in abdomen, nausea, vomiting, giddiness, bloating, heaviness in abdomen, gas, hard abdomen, tenderness, sore burps. Agnimandya as a symptom. Acharya has described Agnimandya as a main symptom in various diseases like Jwara, Pandu, Atisar, Grahani, Ajirna, Gulma, Kamala, Shot, Shwas, Pratishay, Arsha, etc. Types of Agnimandya. Mandagni, Tikshnagni, Vishamagni, Samagni. Effect of Agnimandya on health. Pachak Agni or digestive fire is an essential for the complete and proper digestion of food. When digestive fire, Pachak Agni is low, food is not properly digested and absorbed. This causes buildup of toxins in body or arm. Accumulation of arm causes many diseases. Arm act like poison. It weakens the body due to poor nutrition. Therefore, Agnimandya is the principal cause for all the metabolic disorder. Treatment. Main drugs used to Agnimandya. Sunthi Churna, pungent, dose 500 mg times 2 times a day. Other Ayurvedic medicine to Agnimandya. Agnitundivati 250 mg BD. Ajmodadi Churna 1 gram BD. Chitrakadivati 250 mg BD. Dadimashtak Churna 1 gram BD. Hingvashtak Churna 1 gram BD. Lavan Bhaskar Churna 1 gram BD. Shivaskar Panchachurna 1 gram BD. Shankhavati 250 milligram BD. Dietary tips. Try to identify the causative factors. Do not drink water while having meals. Chew your food properly. Avoid eating full stomach. Take frequent small meals. Do not eat costly food. Conclusion. Thus, we can conclude that there is a detailed description available in various Ayurvedic Samhita regarding concept and principle related to Agnimandya. Acharya has explained very deep scientific relation between Agni and Dosha in different Samhita. Concept of Agnimandya evolution of various diseases. Thank you.
Thank you, doctor. Dr. Ashwini.
Yes, ma'am. Hello.
Hello, Dr. Ashwini. Are you ready to present poster?
Yes, sir. I'm ready.
Okay, doctor. Please share the screen, doctor.
Okay. Hello.
Hello, doctor. Your screen is visible, doctor. Please start.
Okay. Good evening, all doctors and my friends. My name is Dr. Ashwini Zanzar, PG second year scholar from Kai Chikitsa Department of Ashwin Rural Ayurved College, Sangamner. My poster is my poster visible, sir? Hello.
Doctor, visible, doctor.
Yes, doctor,
Screen is
it's
visible.
visible.
Okay. Let's now start. My poster is about breast cancer awareness month. October month is breast cancer awareness month. So I'm decided to present a poster on the topic breast cancer awareness month. Here, early detection key is to prevention. It is better to diagnose early the breast cancer, which is easy for the further treatment and prevention from the breast cancer. Here is some key factor for breast cancer prevention. First factor is key factor is do not ignore any lump or node in your breast. Self-examine your breast regularly. To examine breast, it is by circular method or up-down breast examination method, or note down or examine the following symptom like skin irritation, breast or nipple pain, bloody discharge from the breast, nipple deformation or lump in the breast. Then third factor is in case you are above 14 years, get your mammography done. Fourth factor is avoid smoking and excess alcohol intake. Then risk factor of breast cancer is obesity, aging. Generally, female above the 14 year is a risk factor for breast cancer. Genetic radiation, alcohol and smoking. Then next point is sign of breast cancer is changing in skin texture of breast, inverted nipple or change in the shape of breast, constant pain in breast or armpit, discharge from the nipple, redness or rash on the around the nipple, any lump on a breast, change in the size and shape of the breast. The next topic on my poster is prevention of breast cancer, that is breastfeeding. Then don't smoke, exercise regularly, limit using the hormone medication, limit the exposure to the pollution, limit your alcohol consumption, eat healthy food, watch out for the changes to your breast, go for the mammography. Thank you.
Thank you, doctor.
Thank you, ma'am.
So next I invite Dr. Anushri. I invite
Hello.
Dr. Anushri.
Yes, ma'am.
Hello, doctor. You are audible.
Yes, ma'am. Hello.
Hello, please share the
doctor.
screen,
Please share
doctor.
the screen.
Hello, Dr. Anushri.
Hello. Yeah.
Doctor, you have any problem with screen sharing, doctor?
Yes. 1 second. Is it
Okay, now-
visible?
yes, doctor. Visible, doctor. Please start, doctor.
Okay. Myself, Dr. Anushri J. Shetty, second year PG graduate from Department of Panchakarma, Ramakrishna Ayurveda Medical College, Bangalore. So, my topic is Panchakarma in geriatrics. Mainly Panchakarma, how Panchakarma is dealt with geriatrics. Introduction. Geriatric is a multidimensional process of physical, physiological, and psychological degenerative change. The prevalence of illness increases as we age. At the same time, life expectancy decreases. So Ayurveda has got the potential for prevention of diseases by health promotion and management of diseases occurring in the old age, that is called as Jwaravastha. Panchakarma is a part of Ayurveda which offer many treatment modalities to prevent aging and support relief from the age-related problems. Now, Jaravastha mainly, Jaravastha means the age after 50 years, which can be considered as Vriddhavastha. The main problems which comes during the Jaravastha is related to Indriyas or Manas is loss of Buddhi, loss of Smriti, loss of Indriyas. Related to Indriyas are related with Akshi, visual problems occurs, related with Nasa, loss of smell, related to Karna, loss of hearing, and Jihva, loss of taste, Twacha, loss of elasticity of the skin. Now coming to the Jaravastha, mainly what occurs is in the body, Rasakshaya is the main thing which happens, which leads to Rasakshaya, which leading to Balakshaya in an increased Vata in the body, which gives degenerative changes, constipations, joint pains, etc. Now, common problems in Vruddhavastha, physical problems, system-wise common problems are in cardiovascular, hypertension, myocardial infarction, CCF, respiratory problems, mainly asthma, bronchitis, musculoskeletons like osteoporosis, spasm, drooping shoulders, gastrointestinal like dyspepsia, flatulence, constipation, etc. Genitourinary like nocturia, prostate enlargement, locomotor system, osteoarthritis, gout, endocrinal system, diabetes, thyroid, ophthalmic, senile cataract, glaucoma, hearing, loss of hearing and hard hearing, nervous system, insomnia, problems of hair like hair loss, baldness, cancer incidence and severity, and menopausal symptoms like hot flashes or anything like joint pain, etc. Now, coming to the psychological problems related to uh, Vruddhavastha, like dementia or kind of depressions, being neglected by the family, which causes psychological problems. Social issues in elderly, like marital status, financial status, work history, responsibilities, and living atmosphere. Now, mainly coming to the Panchakarma, which how the what is Panchakarma and how it helps in geriatrics. And mainly Panchakarma is like Vamana, Virechana, Basti, Nasya, Rakta Mokshana. Panchakarma. What is Panchakarma? Panchakarma therapy is a therapeutic technology of Samshodhana Karma, which forms the most fundamental component of Ayurvedic treatment. It offers many treatment modalities like Bahya Snehana, Abhyantara Snehana, Svedana, Basti, Nasya, etc. to prevent aging and support relief from the age-related problems. Panchakarma therapy in the elderly objective has two objective folders. Mainly, it acts in the body in the two ways in elderly people as a therapy of rejuvenation to retard aging, that is to ward off the effects of aging for healthy aging for a healthy aging, as an adjunct in the treatment of diseases of the elderly, to treat the diseases of elderly. So in these two ways it acts. Now, general management, how it acts for disorders like for cognition, type of panchakarma which is used is shirobasti, shirodhara. For senses, netratarpana, nasya, karnapurana, kavala, skin, abhyanga. For the skin, abhyanga, and for the skin, abhyanga and kayasika. For vata disorders, snehana, svedana, and basti. Now, indications of panchakarma in geriatric care. Name of the organ, uh, cardiovascular system, hypercholesteremia, Lekhanabasti is done, urogenital system, BPH, oligospermia, Anuvasana or Astapana Basti is done, respiratory system, bronchial asthma, respiratory allergies, Vamana Virechana, nervous system, neurodegenerative disorders, Shirobasti, Pindasveda, etc. can be used. For the skin, wrinkling and pigmentation dryness, Snehana, Svedana, Vamana, Virechana can be used. Locomotor system like osteoarthritis, cervical and lumbar spondylosis, Snehana, Svedana, Basti, Rakta Mokshana. ENT diseases like Pratishyaya, headache, deafness, sinusitis, Karna Purana, Nasya, Shirodhara, Basti, Shirobasti, etc. Gastrointestinal system, Gulma, next, the digestive disorders, constipation, etc. Vamana, Virechana, Basti can be used. Next aspect is how Panchakarma, Rasayana is main comes in Panchakarma, not Panchakarma. Rasayana is the main treatment for aging that comes in geriatric conditions. So first Jaravastha is equal to Jara Chikitsa. Rasayana is considered to be the one main thing. So अनाविशुद्ध शरीरस्य युक्तो रसायनो विधिः न भाति वाससे क्लिष्टे रुङ्ग्योम् इवाहितः. It is told in Shushruta Chikitsa. For the Samshodhana, after doing all the Samshodhana procedures in the body, Rasayana Chikitsa is done, and then which is the main treatment for to prevent the aging or for the late aging. Next, coming to Panchakarma acts as Rasayana for Abhyanga. Abhyanga as told in Ashtanga Hridaya Sushruta Sthana, Ashtanga Sutra Sthana, second chapter. Abhyanga Machare Nityam Sa Jarashrama Vataha. So Abhyanga is the main treatment, the main coming in which delays aging is Abhyanga. Nitya Abhyanga Jara. Bhavatyabhyanga Nitya Nityatvan Annaro Alpajara Evacha. Next, Shiro Abhyanga Indriyagni Prasidanti Sutva Abhyavati Cha Ananam. Next, Pada Abhyanga, which gives Drishti Prasadam Labhate, which gives Drishti Prasada. Next, Nasya na Jara na Labhate Balam. Main thing is told by Charaka in Sutrasthana 5th chapter. Jara na labhate nasya pratimashanasya, which is done for the senses, and jara na labhate. It's coming to basti, astapana basti, niruha vayastapana and niruha basti is done. Yapana basti mainly, which is told in Charaka Siddhasthana 12th chapter. Sadhyo bala janano rasayanascheti. Main uses of yapana basti is sadhya bala janana, as the bala of the person will be less in jaravastha or vruddhavastha. Rasayana is needed, and for that yapana basti is used. Charaka siddhi swasthanam maturanam cha vruddhanam cha virodinaha. So for every person, swastha person or the person with the disease, yapana basti is useful. According to Ashtanga Hridaya, yapananam rasayananam, mainly yapana basti gives rasayana effects in the body. Next, matra basti, which is done daily according to Ashtanga Hridaya, bala vruddha adva bharasri vyavaya maschintakaihi. So bala vruddha is for the bala vruddha, for adva bara, especially for the vata. When vata is increased in the body, matra basti is useful. And durbale vata bhagne cha matra basti hi sadamataha, told by Charaka in Siddhisthana. For durbala vata bhagne, durbala, the person becomes weak in vruddhavastha, and vata, especially the vata dosha increases in vruddha. This is useful. Now, Madhutailika Basti, Rasayanam, Prameharsha, Krimigulma. These are some of the conditions which is mainly seen in Vruddhavastha. So, Rasayana is done can be attained by Madhutailika Basti, Prameharsha, etc. can be treated. Next, Chatusneha Basti is also given in the Vruddha Avastha according to Charaka, Siddhisthana 12, chapter 18 sloka. Rasayanam uttamam vali palita nashanam vidyat patyatamam. It is considered as patyatamam, and rasayanam uttamam. So chatusneha basti considered as rasayanam uttamam, it is patyatama, and vali palita nashanam. Vali palita nashanam, wrinkles or palita, graying of the hair is treated through chatusneha basti or prevented. Siddha basti basti ryojayo rasayanam. Jeevaniyagana basti, mainly Niruha. Jeevaniyamana basti is given in Shishu Vruddhayoho Param. Shishu or Vruddha, where the ball of the body is least, it helps in Vruddhavastha. So, an apparently normal elderly person should undergo periodical Panchakarma therapy to promote his or her overall health and to avoid the effect of aging. Now, why Panchakarma in geriatric? Why it is used? According to Ashtanga Hridaya Sutrasthana, 18th chapter, Buddhi Prasadam Balam Mindriyadatu Stiratvam Jwalanasya Deeptanam Chirachapakam Vayasaha Karoti Samshodhanam Samyag upasya manam. So this is told in Ashtanga Hridaya Sutrasthana. Why mainly Panchakarma in geriatric is Buddhi Prasadanam, where the in Vruddhavastha there will be impairment in buddhi or something like dementia or some Buddhi Prasadanam. Balam Indriya, Bala, it gives Bala. Panchakarma gives Bala to the person. Indriya will be, in Indriya Vishodhana will be there. Sthiratva of the Indriyas will be there. Next, Jwalanasya Deeptanam. Mainly in old age or in the Vruddhavastha, the conditions where the person will be having constipation, ajirna, or the tastelessness. In these conditions, Panchakarma helps a lot. And Chirachapakam Vayasaha, latening the age or the aging process will be delayed. I mean, the wrinkling or aging process will be delayed. Karoti Samshodhanam. So these are obtained through the Samshodhana or Panchakarma therapy. So mainly benefits of Panchakarma are body detoxification occurred by Panchakarma, balancing metabolism, clearer complexion, better digestive system, enhanced motor or sensory organs, reduced hormonal stress, regulates virility and promotes appetite, provides softness of the organs. These are the common general uses of Panchakarma in the body. So especially in geriatric condition or Vruddhavastha, Buddhi Prasadanam, Balamindriya Dhatu Stiratvam, Jwalanasya Deeptanam, Chirachapakam Vayasaha are they mainly told in Ashtanga Hridaya Sutrasthana. So the conclusion of my seminar presentation is Panchakarma is a green revolution in medical practice where we can eliminate and regulate the dosha and body components to delay the aging process and to minimize the intensity of the problems occurring in this degenerative phase of the one's life. So a healthy and successful aging of everyone desires can be achieved with the help of Panchakarma. Thank you.
Thank you, Dr. Anushree.
Thank you, doctor. So next I invite Dr. Aishwarya Shivaji Kumbhar. I invite Dr. Aishwarya.
Hello.
Hello, doctor. Your voice
Hello,
is
ma'am.
clear, doctor.
Okay, sir.
Please share
Can
the
I
screen,
share?
doctor. Sure, doctor. Please share. Your screen is visible, doctor.
Good evening, everyone. Myself, Dr. Aishwarya Kumbhar, PG Rognidan, second year, LRP Ayurvedic Medical College, Islampur. My guide is Dr. Gauri Muli, HOD and guide, Department of Rognidan. Today's my topic is lab investigations in genetic disorders. India has nearly 120 million elderly people with various physical, psychosocial, economic, and spiritual problems. The physiological changes caused by aging interfere significantly with the functions of organ and systems, which is reflected in the result obtained in laboratory tests. Thus, the correct interpretation of this test depends more directly than a young on analysis of the clinical, functional, and social characteristic of each patient. Aim of lab investigation in geriatrics. Geriatrics, the word in Greek is geron, means the old man. Gerontology is the study of aging process, so that geriatrics is specially of healthcare of elderly peoples. Laboratory investigations in geriatrics provides the guidance of planning care of elderly peoples. The goal of the lab assessment includes the reduction of healthcare cost, early recognition and treatment of geriatric syndromes. Third, improved survival and quality life of patients. There are some limitations in correct values of laboratory investigations for geriatrics, as many of reference ranges of 20 to 40 years old adults, which is directly compared with aged ones. So commonly conditions in geriatrics means that are diseases which are commonly in geriatrics. India, we know multiple physical, sociological, and economical problems needs the dominance of health. If we look the physical and psychosocial dominance, we have to following figure from the previous studies conducted in India. 3.7 million suffer from dementia, 40 million suffer from poor vision, 1.6 million annual stroke case study, 1 in 3 suffer from arthritis, 1 in 3 has hypertension, 1 in 5 has diabetes, 1 in 5 has auditory problems, and 1 in 4 suffer from the depressions, and 1 in 10 falls and sustained by fracture, 1 in 3 bowel disorders. Cancer is a 10 times more common. In addition, that Indian elderly face several social issues such as loneliness, elder abuses, neglectance, lack of income security, and poor access of healthcare. And what are the difficulties in diagnosis of geriatric disorders by lab investigations? As we know, the more are the references between 20 to 40 are variables, and these are variables are compared to aged ones because um, and it is not correctly done because physiological changes are undergoing various physiological changes are undergoing by aging. The validification on the references values three groups of young, old, old, and very old is a challenge in itself because elderly people in perfect health are a rare species. Most of them they have health problems and undergoing irregular medications. Therefore, it takes a great effort to conduct references value studies for the age group. This is very important because we can't the references values are compared to aged ones. And what are the factors affecting to lab test results in geriatrics? As age in a physiological process, there are continuous steady changes occurs in a body. That is a why reference range lab investigations to vary from the young to adults. There are some biochemical and hematological changes in geriatrics. Physiological changes, decrease in gonadal hormones levels, increase in bone loss, impairment of renal function, increase in blood fat levels. Second, lifestyle modifications, inactivity of body compartments, decreasing muscular mass, less supply of vitamin D. Third one is dietary factors, problems with digestion and absorption. Dental problems leads to insufficient intake of vitamins, rich food, alcoholism and obesity. Fourth one is medicinal therapy. Many elderly are taking medicinal therapy due to the comorbidities may cause abnormality in some lab investigation tests. And what are the solutions to the difficulties? The evaluation of in references value in geriatric population in compliance with the regulations of the European guidelines was recently highlighted by Ozerda. Several well-planned and comprehensively performed studies were published in last decades, so showing that many of the routine parameters seem to valid in elderly too. What are the common investigations in male and female geriatrics? That is first, hemoglobin. In elderly, the impairment of intestinal absorption of iron and vitamin B12 may lead to the decrease in hemoglobin and erythrocyte synthesis. Because blood loss is also common, therefore it is recommended to decrease the blood level referent to hemoglobin. Anemia is a particular importance as elderly patients with anemia are higher risk of circulatory and oxygenation problems, hallmarked by fatigue, dyspnea, paresthesia. The area of gas exchange in alveolar surfaces is decreased, leading to decrease in arterial oxygen tension by 4 mmHg per decade. This process results in latent hypoxia. Hypoxia is often associated with congenital problems. Then BSL, blood sugar level, serum glucose levels increased proportionally to age with glucose tolerance is in decreasing. However, blood glucose levels are often low due to the dietary problems. Simultaneously, serum insulin levels are also increased, indicating insulin resistance. This results in impaired glucose tolerance observed in 25% of the patients above 75 years. Therefore, postprandial blood glucose levels are often higher when performing an oral glucose tolerance test. Then third one is ESR. ESR is generally not exactly known, and it is one should not be used for the ESR basis of diagnosis of inflammation in elderly. Then fourth one is serum iron levels. Serum iron levels are decreasing in elderly, probably due to the impaired production of gastric juice. Simultaneously, iron stores decreases also. The other common causes of low iron levels, systematic iron deficiency, chronic blood loss. Therefore, malignancy should be searched for. Fifth one is lipid profile. Total cholesterol levels increased by 1 mmol in 60 years of age. No further evaluation is anticipated, therefore, rather it is old subjects levels, analyte decreases. Triglycerides levels increases by 30 to 50% in males and females respectively. Between 30 to 80 years of age, HDL levels increases somewhat in age of men, while decreasing aged in women. Sixth one is renal function. In general, aged people take several medicines simultaneously. The metabolism part exactly via the kidney. Therefore, it would be the utmost importance to assess the renal function to establish optimal doses. In elderly, the number of function of nephrons decreases by 30 to 45%. This is accompanied by the decrease of glomerular filtration rate. However, the creatinine levels change rarely. As the lean body mass decreases, therefore, net bilirubin and blood urea and creatinine levels are not appropriate to estimate renal function. Instead of GFR calculations is required that the corporate patient's age. TSH, seventh one. Hypothyrosis is not an inevitable consequence of aging. However, it is a quite common phenomenon in aged patients. That is, signs and symptoms include weakness, slowness, and tiredness that are partly attributed to old age. Therefore, it is recommended to screen patient TSH levels. Roughly, TSH is a reference range comparable to the younger one age. One should remember the medicines used in commonly used in old patients may be reference to thyroid hormones. That is, glucocorticoids hormone suppresses TSH and lithium inhibits thyroxine secretions. Specific investigations in male and female. That is, lab investigation in geriatric male, PSA increases in levels of geriatrics and testosterone. Lab investigations in geriatric females, FSH usually increase than young, LH usually increases in than young, estradiol decreases in elderly females. Relative special lab investigations in geriatrics, the values increases in geriatrics and values decreases in geriatrics. Firstly, we see the values increased in geriatrics. Alkaline phosphatase, second ANA, third fibrinogen, fourth FSH, LH, fifth GGT, sixth serum uric acid, seventh IL-6, eighth one PSA, ninth one serum cholesterol, 10th one is insulin. Values decrease in geriatrics. First, aldosterone, second, vitamin B12, vitamin D, third, serum ferritin, fourth, HDL, fifth, serum calcium, sixth one, creatine clearance, seventh one, GH, eighth one, estradiol, ninth one, free testosterone. And what is the conclusion of this paper presentation is We know India has nearly 120 million elderly people with various physiological, physiosocial, economical, and spiritual problems, while the functionally and congenitally, cognitively fit can access usual healthcare facilities provided by the government. These people need active aging program to keep them independent. Health Ministry has created geriatrics centers and geriatrics clinics in the most of the states. However, these centers may not serve the functionally and cognitively impaired elderly. There is a great need for mobile units, daycare centers, and hospitalities, and need for training the persons in home nursing. Routine care clinics cannot be handled to the burden of geriatric populations to addresses the multimodality and severe other age-related problems. Ayurveda is also explained the Rasayana Karma in Bhaishaj Ratnavali and Rasayan Adhyayan in Charak Sanhita Chikitsa Sthan, which helps give the quality of life to geriatric patients and prolonged old age. Yad jara vyadhi vishwasam bhaishajam tad rasayanam. The rasayan is a medicine which destroys the oldness of people. Yatha marana mrutyum yatha bhogavat sudha. Tatha bhaktava rushinah yasa rasayanam vidhi puraha. न जराम च दुर्बल्यम नातुर्यम निधनम च नत दुर्गवन्ति सहस्राणाम rasayanam puraha. While explaining the importance of rasayana in Rasayana Adhyaya of Charak Sanhita, it is stated that the people who consumes rasayan daily wear long life without any disease and debility. These are my references. Thank you.
Thank you, Doctor.
Thank you,
So
madam.
next I invite Dr. Pranadi Chandradas Kohale. I invite Dr. Pranadi Chandradas.
Yes, ma'am. Hello. Am I audible?
Yes,
Yes,
Doctor.
Doctor,
Audible.
you're audible.
Please share the screen, Doctor.
Yes. Hello.
Hello, Doctor.
Okay. My name is Dr. Pranati Charandas Kode, second year PG from Shalyatantra Department, VMT Ayurvedic.
Doctor, your screen is not visible, Doctor.
Yes, sir.
Your screen is not visible, Doctor.
Okay.
Doctor, you have any problem with screen sharing, Doctor?
Okay, sir. I'm trying. Wait.
Okay, Doctor. Yes, Doctor. Now visible, Doctor. Please
Okay,
start.
sir. Okay, sir, my name is Dr. Pranati Charandas Kode, second year PG, Shalyatantra Department, VMT Ayurvedic Medical College, Kharghar, Navi Mumbai. Under the guidance of Dr. Vasha Tangde ma'am, lecturer of Shalyatantra Department, VMT Ayurvedic Medical College and Hospital, Kharghar, Navi Mumbai. My topic is management of perianal abscess in 6 weeks ANC patient, a single case study. And perianal abscess is result due to suppuration of anal gland or suppuration of thrombosed external pile or any infected perianal condition. It lies in the region of subcutaneous portion of external sphincter. So patient was 26-year-old female, came to OPD with complaints of pain at anal region, difficulty in sitting, swelling at anal region, feeling of mass at anal region, PR bleeding, and pain during defecation. She was having history since she was having all the symptoms since 7 days, and she was having history of fissure in ano since 10 years. She was having history of abortion at 32 weeks 4 months back, and now she had conceived again. Her UPT was positive. So after local examination, we had seen that there was sentinel tag at 12 o'clock position, tenderness at 1 o'clock position, external opening was seen at on the sentinel tag at 12 o'clock position. Fissure in ano was present at 12 o'clock position, and anal spasm was present. It was observed that the infection was caused due to the fissure, the sentinel tag and the fissure at 12 o'clock. So the management we can do was aspirate the abscess or drain the abscess. As the patient was pregnant for as the patient had lost her pregnancy for the first time, it was precious pregnancy for her, so patient was not willing for operate. So firstly we had aspirated the abscess under local anesthesia, but the abscess reoccur within 5 days, and the patient was having severe pain, so the patient was willing for operate. Right. So the abscess we had done IND under spinal anesthesia. So we had taken incision at 1 o'clock. We had inspected the abscess cavity. We observed that there was a cavity from 1 o'clock to 11 o'clock position, and from 1 o'clock to 5 o'clock position, and again it was from 11 o'clock to 7 o'clock position. Sentinel tag. So we decided to excise sentinel tag at 12 o'clock position, and then we made a we excise the skin and expose the cavity at 1 o'clock position, 11 o'clock position, 5 o'clock and 7 o'clock position, so that we can keep drain for the abscess, and the abscess would not collect, and we can minimize a recurrence of the abscess again, and she could have safe pregnancy. So we had taken consent from the patient about the risk about her pregnancy, and we had operated. These are some pictures during the operate. These we can see this cavity at different positions at anal region. After 21 days, this is the condition of the patient and the wound. We had kept proline from 1 o'clock to 11 o'clock position, and 11 o'clock to 7 o'clock position, and one proline from 1 o'clock to 5 o'clock position, so as to prevent collection of abscess in these cavities. We observed that before operate patient was having severe pain, but after operate the patient the pain of patient decreased, and patient we did not give any analgesic to patient. Still patient was not having any pain after drainage of abscess. This is clear indication that we were at the right track, and all the abscess was drained. And at post of day 7, the patient was not having any pain, and after operate we had only given one PCM to the patient. After that we had not given any analgesic to the patient, but still patient was not having any pain. So after 5 days we had done USG. So it was observed that her pregnancy was safe. Cardiac activity of the fetus was seen. So after operate, patient got relief from all her symptoms, and her pregnancy was also saved. So thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Pradiksha Suresh. I invite Dr. Pradiksha.
Yes, ma'am.
Doctor, please start. Hello, Dr. Pradiksha.
Yes, ma'am.
Doctor, do you have any problem with your screen sharing?
Yes, ma'am. I'm trying.
Dr. Pradiksha?
Dr. Pradiksha, your screen is visible, doctor. Please start.
Good evening, everyone. Myself Pratiksha Mane, second year PG student, Shalatantra department. Today I am going to present the topic to study the effectiveness of anal dilatation by dilators in fishery nano, a single case study under the guidance of Dr. D.D. Chaman sir, professor and HOD of Shalatantra department. Abstract: treatment of fishery nano is used in management of fishery nano. The study is designated to examine whether anal spasm can be relieved by anal dilatation or anal extension. Introduction. Fissure is the most common anorectal condition. A linear tear in lower end of anal canal is called as fissure. It is very painful condition due to somatic nerve supply. In 85 to 90% of cases, fissure is in the midline posteriorly, and 10 to 15% of cases, it is in midline anteriorly. Fissure can be primarily or secondary. Primary fissure is more common than secondary fissure, and secondary fissure occurs due to the Crohn's disease, ulcerative colitis, other granulomatous diseases. Hello? Hello?
Yes, doctor.
Ma'am, there is some problem.
Yes, doctor. Can you please try it later?
Yes, ma'am.
1 minute, Dr.
Please
Pradiksha.
be there, doctor.
Sir,
Hello,
can
doctor.
you share my PPT?
Okay, doctor. Okay, doctor. I will share for you. Is the screen is visible, doctor?
Yes, sir.
Please start, doctor.
Good evening, everyone. Myself Pratiksha Mane. Sir, next slide. Next. Yes, sir. Case report. A 55-year female patient came with complaints of severe pain and burning sensation at anal region. Pain increases after defecation. PR bleeding on and off. Hard stool. Patient had above complaints since last 1 month. Past history. Patient has history of fissure in ano since 3 months. From last 1 month, she had been suffering from above symptoms like pain and burning sensation, PR, bleeding, and hard stool. Patient is known case of C of gallbladder under treatment. So she should not be taken any analgesic medicine for pain relief. So came to IMTSC for treatment. Material and methods. Anal dilators, small, medium, and large size. Locks jelly 2%. Methods. 5 ml lignocaine jelly instilled in the anal canal with the help of feeding tube. After 10 minutes, digital examination done to assure the effect of local anesthesia. Assorted the size of dilators and inserted in the anal canal repeatedly for 3 to 4 minutes. Day first and second, we use small dilators. Day third and fourth, use medium size. And day fifth and sixth, use large size dilator. Day 7 to 14, dilate with large dilator for maintenance of relaxation. Total period of study is 14 days. Observation. Pain and burning at anal region. Day 1 la severe, day 7 mild, and day 14 mild. Anal spasm. Anal spasm, day 1 severe, day 7 mild, and day 14 no spasm. These are some pictures of dilatation. Day 1, day 7th, and day 14th. Result. After 14 days of continuous anal dilatation, patient got relief from pain and burning sensation. Conclusion. Anal dilatation is effective in fissure in ano and also useful in those patients in which operative procedures are not possible. Anal dilatation releases the spasm of sphincter, and due to this, healing of fissure occurs. Thank you.
Thank you, doctor.
So next I invite Dr. Nagaraja. I invite Dr. Nagaraja K.
Dr. Nagaraja K, are you there? Okay, next I invite Dr. Veena for the paper presentation. Dr. Veena, why?
Yes, sir, I'm here.
Okay, doctor, please share the screen, doctor.
Sir, can you share PPT for me? I'm not able to share it here.
Okay, doctor, 1 minute. Dr. Veena,
Yes, sir.
please start the session, doctor.
Yes, sir. Thank you, sir. Good evening, everyone. Myself, Dr. Veena, final year post-graduation, Panchakarma Department, Ramakrishna Ayurveda Medical College, Bangalore. Now I am presenting a comparative clinical study of Shigrupatra Kvata Nadisveda and Karanjapatra Kvata Nadisveda in Jana Santikata Vata with special reference to knee osteoarthritis under the guidelines of Dr. Bindu P. Patil, Associate Professor, and Dr. Rashmi, HOD of Panchakarma Department, Ramakrishna Ayurveda Medical College. Need for the study. According to WHO, 9.6% of men and 18% of women aged over 60 years have symptomatic osteoarthritis worldwide. The complete remedy of osteoarthritis disease is still not available in modern medication. The drugs used are mainly analgesics, anti-inflammatory, and steroids, which cannot pacify the disease but only provides symptomatic relief. Whereas such conditions can be better treatable by management and procedures mentioned in Ayurvedic classics. Acharya Sushruta has explained Vayu entrapped in Snayu, Hasti and Sanji, which should be treated with Snehana, Svedana, Upanaha, etc. Sneha Prayoga in Hasti and Majja mentioned in Charaka Samhita Chikitsa Sthana. Bahya Snehana and Svedana are two important treatment modalities of choice in disease pertaining to Vata. Svedana is said as a therapy which removes the stiffness, heaviness, and coldness of the body by producing perspiration. Next slide. Nadi Sveda is an external therapeutic measure, produces Sthanika Svedana effect by passing steam over the affected part by using Nadi Sveda Yantra. Sthanika Abhyanga to be done prior to Nadi Sveda. Shigru and Karanja drugs are mentioned under Svedopaka Dravyas in Charaka Samhita Sutrasthana. Roots, fruits, leaves of Svedopaka drugs are mentioned for Nadi Sveda. Shigru and Karanja Patra possesses Vata Kapahara properties. Nirgundi Taila Abhyanga mentioned by Charaka Acharya Charaka for Vata Roga in Chikitsa Sthana. Hence, this study is undertaken to evaluate the effect of Shigru Patra Kvata Nadi Sveda and Karanja Patra Kvata Nadi Sveda after Sthanika Abhyanga with Nirgundi Taila in Janu Sandhigata Vata with special reference to knee osteoarthritis. Objectives of the study: to evaluate the effect of Shigru Patra Kvata Nadi Sveda on Janu Sandhigata Vata, to evaluate the effect of Karanja Patra Kvata Nadi Sveda on Janu Sandhigata Vata, to compare and ascertain the effect of Shigru Patra Kvata and Karanja Patra Kvata Nadi Sveda on Janu Sandhigata Vata. Materials and methods. 30 patients suffering from osteoarthritis of knee joint were selected randomly and divided into two groups, A and B, as per the inclusion and exclusion criteria from OPD and IPD Department of Panchakarma, RAMCH. Inclusion criteria includes patients between the age of 30 to 70 years of both the sexes and the patients who are presenting classical as well as modern signs and symptoms of Janu Sandhigata Vata and patients who are fit for Svedana and radiological changes of knee osteoarthritis. Exclusion criteria includes patients below the age of 30 years and above the age of 70 years, pregnant women and lactating mothers, patients who are suffering from systemic diseases like rheumatic heart disease, diabetic mellitus, etc., and the patient who are unfit for Svedana and who are having history of fracture of knee joint. Study duration. Total number of days was 21 days. Treatment duration was 7 days. Follow-up days on 14th day and 21st day. Assessment criteria. Subjective parameters are Shula, Atopa, Stabda, Shota, Sparsha Asahishnuta, Prasarana Akunchana Vedana. Objective parameters are severity of pain measured by OMAC scale, visual analog scale, and range of movement measured by goniometer, and swelling measured by measuring tape, walking time to cover 20-meter distance measured by stopwatch, and X-ray examination. Study design. Group A contains 15 patients and treated with Shigrupatra Kvata Nadi Sveda. As Purva Karma, Sthanika Abhyanga done with Nirgundi Taila for 15 minutes. In Pradhana Karma, Shigrupatra Kvata Nadi Sveda done using Nadi Sveda Yantra. Duration was till appearance of Samyak Svinna Lakshana. In Paschat Karma, rest for 5 minutes, then allowed for hot water bath. Group A contains 15 patients and treated with Karanja Patra Kvata Nadi Sveda. As a Purva Karma, Sthanika Abhyanga done with Nirgundi Taila for 15 minutes, and as a Pradhana Karma, Karanja Patra Kvata Nadi Sveda done using Nadi Svedana Yantra. Duration was till the appearance of Samyak Svinna Lakshana. As a Paschat Karma, rest for 5 minutes, then allowed for hot water bath. Results. Descriptive and inferential statistical analysis has been carried out in the present study. Results on continuous measurements are presented in mean plus or minus ST, and the results on categorical measurements are presented in number, percentage. Significance is assessed at 5% level of significance. Student t-test, two-tiered independent, has been used to find the significance of study parameters. Overall response. Statistically, both groups have shown insignificant result. Both Group A and Group B has shown response in moderate to marked improvement. However, Group A have shown moderate and complete remission 53.3% compared to 26.7% in group B with p-value 0.1360. Probable mode of action. Nirgundi Thaila has Shodhana and Ropana property, and also it has analgesic and anti-inflammatory action due to its flavonoid content, which acts through inhibition of prostaglandin biosynthesis and also helps in strengthening the new generative vessels. Kuatha. Kuatha contains water-soluble active principles of the herbs. Hence, Kuatha is the one of the best way to enjoy maximum benefits out of the herbs. The freshly prepared Kuatha would have medicinal herbs in active mode and brings about fast action. Shigru. Shigru, it has possessed qualities like Tekshna, Ruksha, Lagu, Ushna, Pichila. These gunas having properties to do Shodhana, Shoshana, Laghava, Svedana, and Lepana. And it is of Katurasa and Tikta Rasa, which does clarify passages, drying, and elevates kapha. Its Ushna Virya acts as Vata Kapha Shamaka and Shota Hara. Katu Vipaka does Vata Kapha Shamana. Moringa olifera limb, botanical name of Shigru, which contains dietary antioxidants like vitamin A, C, E, which provides pain relief and help for regeneration of cartilage. Vitamin B9, vitamin B12 reduces pain and inflammation. Calcium helps for healthy bone structure. Conclusion. There is an intimate relation between Vata and Kapha in Janusandhigata Vata disease. Restoration of Vata to its normal state helps in the treatment of Janusandhigata Vata. The clinical effect of Shigrupatra Kvata Nadisveda and Karanjapatra Kvata Nadisveda was fairly significant to minimize the symptomatology of Janusandhigata Vata. Recommendation for the further study. The study can be repeated with a larger sample and longer duration. Same procedure can be tried along with the internal effective formulations for shift benefit. Thank you.
Thank you, doctor.
Thank
So
you,
next
ma'am.
I invite Dr. Pradeep. I invite Dr. Pradeep Palhat Patil.
Hello, ma'am.
Hello, doctor. Dr. Pradeep, please share the screen, doctor.
Wait, sir, wait. So can you please share my screen? I have issue from my side.
Okay, doctor, 1 minute. Dr. Pradeep Patil, please start, doctor.
Good evening, one and all. Myself, Dr. Pratik Patil, PG Scholar, second year from Saptashungi Ayurveda Mahavidyalaya, Nashik. My guide is Dr. Sadhna Babil, ma'am, HUD and Professor of Department of Commerce. Am I audible, sir?
Yes, doctor, audible, doctor.
So I'm going to present a paper regarding effect of Singhadikrut in the management of ball shoot with special reference to malnutrition. Introduction. Malnutrition is defined as the range of pathological conditions arising from coincident lack of dietary protein or energy in varying proportions. Malnutrition is an important nutritional problem among preschool age children. It's a range of condition occurring when intake of one or more nutrients doesn't meet the requirements. It's not only the deficiency of proteins, but inappropriate food, low in energy density, proteins, micronutrients, etc., both qualitatively and quantitatively. Nutrition is a basic human need that remains unmet for a vast number of children who are thus unable to achieve their full genetic development potential. Today, childhood malnutrition is still one of the major public health problems in the developing country like India due to poverty, illiteracy, and lack of awareness of the society. As per NHFS 5 2019 to 21, the prevalence of stunting, fasting, and underweight under 5 years of children is 35.5%, 19.3, 32.1 respectively. Malnourished children are more prone to systemic infection because infections aggravate malnutrition by decreasing appetite, inducing catabolism and increasing demands for nutrients. Malnutrition can be correlated to balshos in Ayurveda due to excessive sleeping during daytime, excessive consumption of cold water, and breast milk vitiates kaphadi doshas. So causes the dushti of kapha and vata. Dushit kaph along with vat blocks the entire channel, that is sroto avarodha, nourishing the rasa and raktadi dhatus. Due to obstruction of srotasas, dhatu poshak ghatak, which nourishes dhatus, are unable to reach their uh, which leads to their dhatu kshayas. As per food is not properly digested, it fails to nourish all the body result, uh, and it results into emaciation. Sinhadi Growth mentioned in Ashtanga Hridaya by Acharya Vagbhata is the best management of bal shows. Hence, an attempt was made to study the effect of Sinhadi Growth in the management of bal shows under nutrition. Aims and objectives of the study to assess the effect of Sinhadi growth in the management of Balshot with special reference to malnutrition. Here is a case report. A 3-year-old male child having following complaints was came in OPD of Comorbidity Department, SSM College, Nashik. Chief complaints: Aruchi, that is reduced appetite, shosh, and Jwaranubhuti, Twak and Kesh Rukshitha since last 12 months and aggravates in last 2 months. Birth weight of child was 2.5, and no, there were no any congenital disorder, no any normal, there were normal birth history, no major illness was there. Labor was normal, delivery normal labor. Infant has a history, mother has a history of previous miscarriage in third month. uh, Social history, father was 33 years and mother was 26 years. Marriage history of both was within normal limits. So next slide please. Next. Next. Sarvadayik Parikshan. Sarvadayik Parikshan, heart rate of child was 110, RR was normal, patient was euthermic. त्वचा रुक्षता, नख रुक्षता, केश अरुण वर्ण, नेत्र रुक्षता, जीवा ईशत साम, मलद्वार प्राकृत, मूत्रद्वार प्राकृत, निद्रा अल्प, रोदन अतिरोदन, नाभि प्राकृत आणि ज्ञानेंद्रिय परीक्षण was done, and स्पर्शनेंद्रिय त्वच रुक्षता, चक्षुरेंद्रिय नेत्र रुक्षता, रसनेंद्रिय प्राकृत, हस्त शोष, पाद शोष. Now, in the management, there is Sinhadi Growth. So we have given the dose 5 gram twice a day to the child with Anupan Koshnajal. Kal was booked, and treatment duration was 60 days. Sir, next slide. Hello. Next. Hello. Next. Treatment duration 60
1
days.
second, doctor.
Hello, doctor. Screen is visible, doctor.
Yes, sir. Yes. Composition of Sinhadi Growth. In Sinhadi Growth, there is a Kantakari, Ashwagandha, Tulsi, Pipali, and Grit. Now, we have we know all the Latin names and family and parts used. So I don't want to waste time. Next one is sir. Next, please. Composition. So contents of trial drug Kantakari, Rasa Tikta Katu, Guna Guru, Ruksha, Virya Ushna, Vipak Katu, Dosh Karma Dipaniyan Balya, Ashwagandha, Ras Tikta Kashai, Guna Laghu, Virya Ushna, Vipak Madhur. So the Dosh Karma Balya, Rasayan, Vata Kafahara, Tulsi, Ras Katu Tikta, Guna Ruksha Laghu, Virya Ushna, Vipak Katu, Dosh Karma Pittahara Kafahara, स्थैर्यकर पिपली कटुतिक्त मधुरा गुण स्निग्ध एंड लघु वीर्य अनुष्ण विपाक मधुरा दोष कर्म रसायन हृदय हृदय वातहर कफहर घृत मधुर गुण स्निग्ध शीत वीर्य शीत विपाक मधुर दोष कर्म त्रिदोष शामक रसायन बल्य सर नेक्स्ट प्लीज observation and results of the study were, was objective parameters here and subjective we classify in both types. So objective parameters we have taken weight, height, BMI and mid-arm circumference. Now you can see there before treatment and after treatment how it changes. Sir, next slide please. Parameters, okay, sorry. Subjective parameters, hair pigmentation. Now we see there is a flag sign mentioned regarding the malnutrition. Alternate hair bands we see in malnourished children. So we have taken hair pigmentation as a subjective parameter here. So there is a score before treatment and after treatment. You can see normal hairs, hypopigmentation at the tip of hairs, hypopigmented hairs involving 2/3 length of hairs, small hair of areas of scalp showing hypopigmented hairs, alternate bands of normal and small hypopigmented hairs. That is flag sign. I have explained already. Skin elasticity we have also taken here. Normal skin turgor, loose skin with some fat, with pinch and release return to normal, slowly taking 2 to 3 seconds. Loose skin when pinch and release return to normal, very slowly taking few seconds, and thin and loose wrinkled skin. So we have given score to this, and before and after treatment, we have seen the changes here. Abhyoharan Shakti also there, third point. Taking food in good quantity twice a day, taking food moderate quantity twice a day, taking food in less quantity twice a day, child not taking food at all. These are the 4 points here. In Dehabala, patient look cheerful, lethargic and tired, and patient looks gloomy. So we have taken these points and compare the study. A discussion here, Balasuch is responsible for 22% of India's burden of disease. The prevalence of underweight children in India is one of the highest among the world. So Balasuch, which can be correlated to undernutrition, that's PM, of modern size, is one of such a disease that is occurring in children due to hampered nutrition or dhatu poshan. This disease has been described in detail by Acharya Vagbhada only, but other conditions that are similar with the signs and symptoms of Pakka, Karshya, Gatra shows, etc., also described in all Samhita by the Acharyas. Regarding into Samprapti of Balashosha, there are two main entities, Vat, Kapha, Prakop, and Strotorod, which ultimately leads to improper nutrition and emaciation of dhatu. Next. As the disease is Srotorodajanya with the predominance of kapha, the treatment should be Srotoshodhan. Balashosh is a disease related with dhatu and its nourishment. Hence, the treatment should be aimed at agitation of Jataragni, that is Deepan Pachan, along with proper nourishment, that is Brihan. Sinhadi growth mentioned in Ashtanga Hridaya by Vagbhati is the best in the Balshosh. Balshosh. Sinhadi growth contains Kantagari, Ashwagandha, Tulsi, Pippali, and Krit. All these drugs are well known for their Srotoshodhan and Brihana Karma. These drugs help in improving digestion and increase the appetite by agitating the Jataragni and helps to maintain nutrition of the body and weight gain. Next. Patient was advised to give regular follow-up in successive patient was advised to give regular follow-up in successive follow-up. Uh, he was observed every 15 days. After complete follow-up, results in objective and subjective parameters were recorded and analyzed, as I shown here. This study requires further research in order to study for its better effects of Ayurvedic remedies on Balshos. Further research can be carried out by the increasing duration of treatment and modeling the dose according to the age and weight of the patient. This study show there was a significant improvement in weight, height, mid-arm circumference, body mass index, hair pigmentation, skin elasticity, Agni-bal, and Deha-bal in patient. Next. Bal Shoj is more common in India and it is the most common cause of morbidity and mortality. Shaman Chikitsa in the form of Sinhadi group played an important role in the management of Bal Shoj. Therapy was well tolerated by the patient and no adverse effect were seen in patient. There's improvement in parameters, specifically weight, height, MAC, body mass index, hair pigmentation, skin elasticity, Agni-bal, and Deha-bal. These concepts, taking in mind, the study should be carried out on a large sample for serving the happiness to the mankind, and it will really help the society. These are the references of my study. So next. Thank you.
Thank you, doctor. So next I invite Dr. Nagaraja.
Thank you, ma'am. Hello.
Yes, you are audible, doctor.
Okay. Can I share my screen, ma'am?
Yes, please, doctor.
Hello. Is that visible?
Yes, doctor.
Yes, doctor. Visible, doctor.
Good evening, everyone. Myself, Dr. Nagaraj, second year PG scholar from Government Ayurveda Medical College, Bangalore. Today I am going to present topic on plastic surgery. Plastic surgery, Acharya Sushrita, father of plastic surgery. Plastic surgery, the plastic derived from the Greek word plastikos, which means to modulate or to shape. Plastic surgery is the medical specialty concerned with the correction or restoration of form and function of body structure damaged by trauma, transformed by aging process, changed by disease process and malformation as a result of congenital defect. The goal is correction of perceived disfigurement, restoration of impaired function, improvement of physical appearance. Technique used for plastic surgery: incision, excision, microsurgery, laser surgery, dermabrasion, liposuction, chemosurgery, and electrosurgery. Plastic surgery mainly categorized into two groups. One is cosmetic surgery and reconstructive surgery. The first one, reconstructive surgery. Definition goes like: reconstructive surgery is all about repairing people and restoring function. It is performed to repair and reshape bodily structure affected by birth defect, developmental abnormalities, trauma or injuries, infections, tumors, and disease. Indications are congenital and acquired. In congenital, cleft lip and palate, vascular anomalies, hypospadiasis, craniofacial condition. In and prominent ears, constricted ears, and microtia. When it comes to acquired, cancer, infections, burns, and trauma. Techniques: skin graft, tissue expansion, flap surgery. In skin graft, a skin graft involves taking a healthy patch of skin from one area of the body known as the donor site and using it to cover another area where skin is missing or damaged. The piece of skin that is moved is entirely disconnected and requires blood vessels to grow into it when placed in the recipient site. Skin graft, the major two types are split thickness skin graft, full thickness skin graft, composite graft, and another one is autograft, allograft, and xenograft. Autograft is tissue obtained from patient own skin. Allograft means obtained from donor of same species. Xenograft means obtained from donor or different species. The techniques involves tissue expansion, and flap surgery. The flap surgery is of mainly three types: local, regional, free. The local flap is immediately adjacent to donor tissue. Regional is nearby, means not immediately adjacent to donor tissue. Free flap means remote donor tissue. Advantages and disadvantages of reconstructive surgery. Advantages: the main advantages of the reconstructive surgery is that it gives a normal look to the patient. This will also have a great effect on the patient's self-esteem and will give her an emotional well-being, which is important in all aspects of life, including the professional and personal aspects. Disadvantages of reconstructive surgery. The main disadvantages of reconstructive surgery may be the cost involved. Depending on the complexity of the surgery, the cost may not be within the budget of many patients. Another disadvantage is that choosing an inexperienced surgeon can result in poor quality work, which may require a new surgery to fix. And second one is cosmetic surgery. Definition: cosmetic surgery include surgical and non-surgical procedures that enhance and reshape structure of the body to improve appearance and confidence. The general types are breast fat reduction, body lifts, face and neck, minimally invasive, male specific plastic surgery, and vaginal rejuvenation. When comes to breast augmentation, also called augmentation mammoplasty, breast lift, also called mastopexy, breast reduction, also called reduction mammoplasty, fat transfer breast augmentation, also called fat grafting and breast augmentation. When it comes to body lifts, arm lift, body contouring, body lift, buttock augmentation, mommy makeover, thigh lift, and tummy tuck. When it comes to minimally invasive procedures, examples are botulinum toxin, chemical peel, dermabrasion, dermal fillers, laser hair removal, laser skin resurfacing, microdermabrasion, skin rejuvenation and resurfing, spider vein treatment, also called sclerotherapy. When it comes to male specific plastic surgery, they are gynecomastia surgery and hair transplant. It includes surgical hair transplant and non-surgical hair transplant. And gender confirmation surgery, it includes trans feminine and trans masculine. Recent advancement in plastic surgeries are endoscopic facelift, fat transfer for breast augmentation, smart lipo for liposuction, laser skin resurfacing. History of plastic surgery. The oldest surgical reference found in ancient Egyptian medical text. This reconstructive surgery technique was being carried out in India. Sushruta was a surgeon that made important contribution to the field of plastic and cataract surgery in 6th century BC. The medical works of both Sushruta and Charaka, originally in Sanskrit, were translated into the Arabic language during the Abbasid Caliphate in 750 AD. The Arabic translation made their way into Europe. Reference of plastic surgery in Veda, for example, Gajanana, the reconstruction of head of Ganapati. Plastic surgery in Ayurveda. Sushruta has described plastic surgery, in particular Nasa Sandhana, Karna Sandhana, Oshta Sandhana are mentioned in Ayurveda. Contribution of ancient Indian surgery in the field of plastic operation cannot be overestimated. It's true that in old days, one of royal punishment was to cut away earlobe, no CTC. Indian surgeon has applied their injurious technique for correcting such deformities by shifting the skin flap to refer. Sushruta explains 15 methods of Karna Sandhana. They are Nemi Sandhanaka, Utpala Bedaka, Valluraka, Asangima, Aharya, Nirvedima, Vyayojinam, Kapata Sandhinam, Ardha Kapata Sandhinam, Sankshipta, Hinakarana, Vallikarana, Ishtikarana, Kakoshtaka, and Gandakarana. And Sushruta mentioned Nasa Sandhana Vidhi, also called rhinoplasty, for nose either lost by disease or by trauma. Description of Nasa Sandhana Vidhi is available in Sushruta Samhita. The original method of Nasa Sandhana reveals that first of all, the leaf of next Oshta Sandhana Vidhi. Master Sushruta mentioned Sandhana Vidhi of Chinna Oshta for Kandoshta. Sandhana Vidhi of Chinna Oshta is same as Nasa Sandhana Vidhi. The only difference is that in lip surgery, there is no use of stem of Erandanala. In Sushruta, it is also mentioned that Vaidya who gets killed in these reconstructive surgery become Raja Vaidya, that is, who can treat the king. So from above view. Thank you.
Thank you, doctor. So next I invite Dr. Akshay.
Yes, ma'am. Am I
I
audible?
invite. Yes, doctor, you are audible. Please start.
Let me share my screen.
Okay, doctor. 1 minute, doctor.
Yes, ma'am. Hello.
1 minute, doctor. Please
Yes,
wait,
doctor.
doctor.
Yes, sir.
Doctor, can you please send me your PPT?
I have sent it already, sir. Can I share my screen?
Okay, doctor. You can share, doctor.
Let me share my screen.
Okay, doctor.
Hello.
Your screen is visible, doctor.
Yes. Let me start my presentation, sir.
Okay, doctor.
Good evening, all. Here I am Dr. Akshay Nitin Hemade, Shalyatantra Department, Dr. G.D. Paul Foundation, YMT Ayurvedic Medical College and Hospital, Kharghar, Navi Mumbai. Guided by Dr. Sanjeev Yadav, Guide and Professor, Shalyatantra Department. Here my title is Ayurvedic Management of Mutrashmari, that is renal calculus. Introduction of topic is Mutrashmari is disease related to Mutravah Srotas, in which Ashma means stone forms in urinary system, hence it is called as Mutrashmari. It is Trijosha Vyadhi with predominance of Kapha dosha. Acharya Sushrut considered it as Ashtamahagada and as Yama because of its severity in symptoms and difficulty in treatment, where Acharya Chara considered it as Basti Marmashrita Vyadhi. Treatment includes drugs as well as surgical procedures. Case presentation: a 40 years old male patient came in OPD by reference of urinary complaints since 4 months with no current management. Patient had no previous medical history or surgical history. No addiction history was there. No allergy history was there. Patient was examined by doctor. Here general condition was good and all vitals were stable. But chief complaints were Todavetu Vedana, pain was there. Mutra Dhara Sangha, that is dribbling micturition was there. Sarakta Mutrada, that is hematuria was there. And Sparsha Sahatva, that is tenderness on the site, it was there. Examination. Examination was done clinically and as well as investigations were done. In investigations, we have done USG KUB, that is ultrasonography of kidney, ureter, bladder. For analysis of shape, that is Akruti. size, that is akara, and location, that is sthana of Ashmari. Urine analysis was also done. Routine and microscopic urine analysis was done for analysis of Varna Rupa of Mutra and other conditions. Here in Ayurvedic management, we have used Gokshur Panyakshar as a key treatment, which is stated by Sushruta Acharya in Shalyatantra. That is 250 mg Gokshur Panyakshar was given in Apankala orally with Anupana of Jala. And with it, for Anulomana, we have given Varunadi Kwatha 40 ml in Apankala orally. Then Karya Karana Bhava guest was Tikshna Sukshma Vatahara Kapachedaka Guna of Gokshur Panyakshar helped in Ashmari Bhedana. And then Vatahara Anulomak Kleda Vahak Guna of Varunadi Kwatha helped us in Ashmari Nirharana. Here we prepared Gokshur Panyakshar as regular Panyakshara and given it to the patient for 28 days. And then after follow-up, the result was gradual improvement in all symptoms. Here we discussed Mutrasmari, Apanvayu, Ashmari Bhedana Karya, Vatanulomana Karya, Vedana. Thank you. Hello.
Hello, doctor.
Hello.
Thank you, doctor. Thank you, doctor.
Thank you. Thank you.
So next I invite Dr. Shubhangi.
Good evening, ma'am.
Good evening, doctor.
Let's start.
Yes, doctor, please. Hello, Dr. Shubhangi.
Yeah, ma'am, I'm trying to share my PPT, ma'am. Just wait a minute. Is my screen is visible, ma'am?
No, doctor.
Ma'am, please share my PPT, ma'am. I'm facing issue.
Just a moment,
Okay, doctor. I will share for you, doctor.
Okay, sir.
Please start, doctor.
Thank you, sir. Myself, Dr. Shubhangi, PG Scholar, Department of Shalya Tantra, Government Ayurvedic Medical College, Bengaluru, guided by Dr. Shilpa PN, Professor of Department of Shalya Tantra, Government Ayurvedic Medical College, Bengaluru. Introduction. Acharya Sushruta considered that which is causing pain to body as Shalya. Pranashta means that which not visible. Pranashta Shalya means invisible foreign body hidden inside the body. If it is left unnoticed, it may lead various conditions, and in some cases it becomes fatal too. So early diagnosis of such hidden foreign body and its removal is necessary. Acharya Sushruta had given detailed description of Pranashta Shalya in Sutra Sthana 26th chapter and its Liharana Vidhi in 27th chapter. In that, he explained about the definition of Shalya and Pranashta Shalya, its Bheda, Gati, Ashraya, composition, Samanya and Vishesha Lakshanas, Shalya Sthana Jnanopaya, Anta Shalya Avastha, Visheshana Asakta Shalya, and different methods of Nirvana in detail. He had also explained about the features which will indicate whether Shalya is removed from the affected area or not. Acharya Sushruta had explained about the instruments used to remove Shalya which can be used in present scenario also. Shalya Bheda. Shalya is mainly of two types, Shararika Shalya and Agantuja Shalyas. Shararika Shalyas are Danta, Roma, Nakha, Dhatu, Dushtamala, Annamala. Agantuja shalyas are those originating outside the body. Shalyagatis are 5 in number. Urdhva upward direction, Adha downward, Arvachina backward, Tiryaka sideward, Riju straight, Shalya ashraya, Tvaka, Mamsa, Sira, Snayu, Asti, Sandhi, Koshta, Dhamani, Shrotas, Asti Vivara, and Peshi. Next, sir. Shalya Lakshana, two types. Samanya Lakshanas, Shavam, blackish discoloration, Pidako Chitam, Shofa, swelling associated, Vedana Vantam, Murmur, pain often, Shonita Shravinam, hemorrhage, Budbudha elevated like bubble, Mrudu Mamsam, surrounding skin is soft, Vaisheshika Lakshana, Vakagata, Vivarnata, discoloration, Ayata Shofa, widened swelling, Katina hard, Mamsagata, Shofa Athivriddhi, increase of swelling, Shalya Marghanu Anupasamrohana, appearance of new growth in the path of foreign body, Pidana Asahishnata, inability to tolerate pressing, Chosha, sucking pain, Paka, formation of pus, Peshigata, same symptoms of Mamsagata except Chosha and Shofa, Shrotagata, Shrotasam, Swakarma, Gunahani, loss of function and quality of Shrotas, Siragataha, Sira Admanam, distension of veins, Shira Shulaha, pain, Shira Shofaha, swelling of vein, Snayagata, Snayu Jalo Shepam, lifting up of ligaments, Samaramba, swelling, Ugra Rukaha, severe pain, Dhamnigata, Surfenam, Raktam Niryana, Anilaha, Sashabda Nirgachanam, Vata getting aggravated cause flow-frothy blood associated with sound, Angamarda, pain all over the body, Pipasa, thirst, Rullasa, nausea, Astigata, Vividha Vedana, Pradurbhava, different kinds of pain, Shofa, swelling, Asti Vivaragata, Asti Purnata, filling of the cavity, Asti Nistodaha, constant pricking pain, Samharsho Bala Vamshacha, profound horripilation, Sandhigata, symptoms same as that of Astigata along with Chestoparama, loss of function, Poshtagata, Atopa, gurgling noise, Anaha, flatulence, Mutra Purusha Ahara Darshanamcha, Pranamukataha, appearance of flow of urine, feces, and food particles from the orifice of the wound, Marmagata, Marma Vidhava Cheshta, symptoms similar to Marma Abhighata mentioned in 25th chapter of Shushruta Samhita Sutrasthana, Sukshma Shalya, Lakshana, Anyasa Aspastani, symptoms will be present but slightly. Shalya Nirharana, there are 15 types. First one is Swabhava, by nature, by its own. By Swabhava, it will come out during acts like Ashru, Udgara, Kasa Mutra, Purisha, Anila. For example, Shalya in Nayana comes out by tears, Pachana, making Paka or suppuration. The 7 slides. Poshtagata, Atopa gurgling noise, Anaha flatulence, Mutra Purusha Ahara Darshanamcha, Pranamukataha, appearance of flow of urine, feces and food particles from the orifice of the wound, Marmagata, Marma Vidhava Cheshta, symptoms similar to Marma Abhighata, mentioned 25th chapter of Shushruta Samhita Sutrasthana, Shukshma Shalya, Lakshana Aspastani, symptoms will be present but slightly. Shalya Nirhana Vidhi, 15 in number. First one is Swabhava, by nature, by its own. By Swabhava, it will comes out during acts like Ashru, Udgara, Kasa, Mutra, Purusha, Anilaha. For example, Shalya in Nayana comes out by tears. Pachana, making Paka, a suppuration. Vedana, cutting or breaking. Shalya, which is deep-seated in Mamsa and not causing burning, should be removed by making Paka using Lepa. If it is not coming after Paka also, then do Vedana. Fourth one is Dharana, making bursting. After Paka, if Shalya does not comes out, then Dharana with Ushnalepa is done. Fifth one is Pidana, squeezing. If after Dharana Shalya is not coming out, then Pidana should be done with hand or with Pidana Dravya Lepa. Sixth one is Pramarjana, cleansing. If minute Shalya has entered the eyes, it should be removed by using hairbrush, hand or cloth. Nirdhapana, a snuff. Shalya, which is Ahara Shesha, Anu and Heen are removed by Swasana, Utkasana and Nirdhapana. Vamana, Annaja Shalya by including Vamana, if it is in stomach. Pratimarsha, Angulya Gharshana with inserting fingers of Shalya is in throat. Virechana, purgation. Shalya in Pakvasha, Prakshalana, washing. Pranadosha by Prakshalana should be removed. Pravahana, straining to expel out. In case of Vata, Mutra, Purisha and Garbha Sangha, it should be removed by Pravahana. Achushana, that is sucking. In case of Maruta, Udaka, Vishya Rudira, Dushtasthanya Sangha, by Achushana using Shranga or by mouth. For example, breast pump to extract milk or Shranga Avacharna should be done. Next, Ayasthanta, use of magnet to pull out. Shalya, which is in Anuloma Gati, Anavabhadra, Akarna, Analpa, Vranamukha. It should be removed by using Ayasthanta. Next one is Harsha, making happiness. Shoka Shalya produces due to many reasons, removed by Harshana. Conclusion, in olden days, without much investigatory methods and anesthesia, surgeons put their best effort to extract the Shalya without much complication and damage to the body. In present day, advanced techniques are there to detect foreign body. Acharya has also mentioned that whatever may be the method used, the main aim is to remove pranashta shalyas. By using Aptavachana and advanced techniques, we can diagnose and extract foreign body more appropriately. Thank you.
Thank you, doctor. So next I invite Dr. Mohini Grewal. I invite Dr.
Yes, ma'am.
Mohini.
Yes, ma'am. Is it visible?
Yes, doctor.
Myself, Dr. Mohini Grewal, PG second year, Sri Rog Prasuti Tantra Department from Dr. D.Y. Patil Ayurved College. My guide name is Dr. Pradnya Shirke. My topic for the poster presentation is Garb Sanskar. It contains yoga, Ayurvedic Garbhini Paricharya, reading of spiritual books and mantras, music, and diet. These are the efforts for the enhancement and betterment of the fetus. So Garbs, I will add something. Garb Sanskar itself made up of two words, Garb and Sanskar. Garb means fetus in the womb. Sanskar means to include the better qualities and to educate the mind. And it is the development of a bond between the mother and the child. It is a positive thinking and attitude promotes physical well-being of the mother. I want to add something about these points. Yoga, it should be performed with trained and experienced teacher who knows the adverse effect of the unnecessary movement. And Ayurvedic Garbhini Paricharya, Charak and should have mentioned about it in the text. Music therapy, it gives positive energy to the body and keep mind calm. Diet, Charak and Shushud both has mentioned the food regimen month wisely for 9 months. Garb Sanskar is all about being in a good state emotionally, mentally, physically, and spiritually for the sake of growing baby. It makes trouble-free and disease-free pregnancy. It prevents complications. It ensures natural delivery. There will be a better postnatal recovery. So Garbh Sanskar is nothing but the qualitative antenatal care. Thank you.
Thank you, doctor.
Okay.
Next, I invite Dr. Manoj Srigari Rao. I invite Dr. Manoj.
Hello. Yes, ma'am.
Yes, doctor,
Am I
you are
audible?
audible. Please start.
Please let me share my screen. Is it visible?
Yes, doctor. Visible, doctor. Please start, doctor.
Okay. Good evening, everyone. I am Dr. Manoj Raut, second year PG student from Department of Panchakarma, SMBT Ayurved College and Hospital, Igatpuri, Nashik. Today's topic of my presentation is randomized control study to evaluate the efficacy of Swadhamshtradi Tail Abhyanga in pain management of Janusandhigat Vat vis-a-vis knee osteoarthritis. Sandhigat Vat, in classical text, it describes as Hanti Sandhigatah Sandhin Shul Atopakaroти च वातपूर्ण धृति स्पर्शः शोथः संदिगते अनिले प्रसरण आकुंचनयोः प्रवृत्तिश्च वेदना. Madhav Nidan 22-21. It is correlated with osteoarthritis, which is a long-term chronic disease characterized by the degeneration of cartilage in joints, which results in bone rubbing together and creating stiffness, pain, and impaired movement. The disease most commonly affects the joints in the knee, hands, feet, and spine. Prescribed line of treatment in classical text is Bhayabhyantara Snehehi Asti Majagatam Jayat. Charak Viman 2893. Pain anywhere in the body is primarily caused due to the Vat Dosh Prakop. This Vat Dosh is best pacified by oleation. Abhyanga is the procedure of external oleation, so it is indicated in the line of treatment of symptoms like pain due to Sandhigat Vat in all classical texts of Ayurveda. Abhyangam Swedanam Bastirnasya Sneho Virechanam Snigdha Amlam Lavana Swadhu Vrisham Vat Amayapaham Sandhi Snayugate Vate Daha Sedo Upanahanam Vangasen Vatvadi 30. Mode of action of Abhyanga on pain. Ayurvedic concept of Abhyanga with oil is mostly associated with pacifying Vat dosh, which is the main causative factor of pain anywhere in the body. Massage with oil externally over the affected region increases skin temperature and enhances blood flow in local region. This causes absorption of the oil, which facilitates the nourishment of degenerating tissues. So, a randomized clinical study is being conducted to evaluate the efficacy of Abhyanga in pain relief by two different oil in the patients suffering from Janusandhigat Vat vis-a-vis knee osteoarthritis. Thank you.
Thank you, doctor.
Thank you, doctor. So next, I invite Dr. Pradima Naresh.
Yes, ma'am. Hello.
Yes, doctor, you're audible. Please share the screen.
Yes, ma'am. Ma'am, will you please share my PPT?
1 minute, doctor.
Dr. Sabin.
1 minute, doctor.
Yes, sir.
Doctor, please start the session, doctor.
Yes, sir. Good evening, all. My today's topic is case report on Shaman Chikitsa and Shirodhara on Khalitya and Darunak. Myself, Dr. Pratibha Naresh Gavan, PG scholar, second year from Dr. D.Y. Patil College of Ayurveda and Research Center, Pimpri, Pune. My guide name is Dr. Mamta Nakade. So abstract. Next slide, sir. Continuously increasing industrialization and urbanization has posted greater threat on health and hair due to pollution, contamination of water, air, and stress. There is an increase in the incidence of hair fall, which known as alopecia, which is correlated with Khalitya in Ayurveda. Ayurvedic treatment provides holistic approach like Shodhan, Shaman, Nidan Parivarjan, and Rasayana. In our OPD, a female patient aged 25 with complaints of excessive hair fall and dandruff and itching all over head was managed by Shirodhara with Jatamansi Tela and certain internal Ayurvedic drugs. Introduction. Next slide, sir. Hair forms an important anatomical structure of body which not only has protective function but also beauty to the face. Increasing industrialization and urbanization has posted greater danger on health of hair due to pollution, contamination of water, air, and stress factor. A female unmarried patient aged 25 years came to Panchakarma OPD with registration number. Hospital her dietary history shown she has irregular food habit and mixed diet with high intake of hot and spicy food. No personal and family history of any major systemic illness was present. Ratri Jagran and stress regarding the diseases were present at etiological factor. Case report. On physical examination, patient was found febrile with blood pressure 122 80 mm of Hg. Pulse rate was 76 per minute. RR was 18 per minute. On systemic examination, no abnormality was found in respiration, cardiovascular, and central nervous system. On scalp of and head examination, dandruff were visible. The patient was Vata Pitta Prakruti, having Madhyam Koshta and Madhyam Bala. Rasavah, Raktavah, Astivah, Manavah, and Svedavah Srotadrushti Lakshanas were observed. Now, clinical examination. Nadi was Kapha Pradhan, Mala was Samyak, Mutra was Samyak, Jiva was Sam, Kshuda was Kshuda Prachiti, Akruti was Madhyam, Trishna Samyak, Nidra Samyak, Shabda Prakrut, and Sparsha Shamasitoshna. Treatment schedule. So, Shodhan Chikitsa is given to patient. Patient was treated OPD basis. Patient was advised to perform Shirodhara with Jatamansa Tel. So, next slide, please. For 45 minutes and Nasya with Indriya Tarpan Tel, 8 drops on each nostrils. Shirodhara procedure. Shirodhara procedure, as we all know. So, I will skip this. Then, Saman Chikitsa. अस्थिपोषक वटी of 500 mg, सूक्ष्म त्रिफळा 250 mg, क्रिमिकुटार रस 60 mg, आरोग्यवर्धिनी 250 mg. These are drugs we use. Manjistadikvat 4 tablespoon 3 times with equal amount of water. Panchatikta Ghruta 2 tsp 3 times before meal with hot water. Anulomak vati 1 tablet of 2 gram was advised at night after meal. It was advised from first to last sitting of Shirodhara, which was of 15 days. So pictures are there before treatment and after treatment. A discussion. The Ushna. So next slide, please. The Ushna and Tikshna Vidhi Ahar leads to Pitta Dushti, while the Ruksha Guna Yukta Ahar leads to Vata Dushti. Vikshepa Guna of Vat leads to Kesha Bhagna and Chuti. Later, Gana Guru Kshita Gunas of Kapha influence the Rakta and leads to Avrodha of Sangha and Sangha in the Romkupas. Excessive indulge in cold water and cold weather leads to Vata and Kapha doshas. Atapati seven, Raja and Dhuma seven means excessive exposure to heat, dust and fumes without proper protection to head, which may result in excessive sweating. Ati Maithun increases Vata dosha, Ati Swapna and Ratri Jagran leads to Kapha and Vata respectively. Vegavrod leads to Vata Vaigunya. Then manas hetu, chinta, shoka, krodha, bhaya, all these are responsible to increase vata and pitta dosha, dushti, thereby rasa dushti, which in turns to vitilation of other doshas. Roga marga is bahya and adisandhan is kesha bhumi. Rakta mokshana is specific process for elimination of rakta and pitta dosha. So conclusion, there was marked improvement in the case of Khalitya. Patient has complete relief in dandruff, itching in scalp, and marked relief in hair fall, Khalitya. Though it is difficult to manage, but internal medicines given to patient followed by Shirodhara can be a good option for Khalitya and Daruna. Thank you, sir.
Thank you, doctor.
Yes,
So
ma'am.
next I invite Dr. Pradiksha Khorat. I invite Dr. Pradiksha.
Yes, ma'am.
Yes, doctor, please start.
Hello.
Dr. Pradiksha, please start.
Can you share my PPT, ma'am?
Okay, doctor. Dr. Sabin.
Okay, doctor. 1 minute, doctor. Hello, Doctor Pradiksha. Doctor,
Yes,
there was a problem in screen sharing, doctor. We'll call you next, doctor.
okay, sir.
So next I invite Dr. Pradiksha Ramdas. I invite Dr. Pradiksha Ramdas.
Hello.
Yes, doctor. You are
Hello.
audible.
Good evening. Good evening,
Good
ma'am.
evening, doctor.
Good evening. Myself, Dr. Ma'am, will you please you can share my PPT?
Sorry, doctor, we are not, we are unable to share the screen now. If you can, then please share.
1 second.
Yes, doctor, it's visible. Please start.
Good evening, everyone. Myself, Dr. Pratisha Barki, MD second year from SMBT Ayurved College, Nashik. My guide name is Dr. Satish Ure, and my topic of presentation is benefits of Shiroabhyanga in Daruna. Daruna, it means we usually call it as dandruff. It is a condition caused by imbalance of Vata and Kapha dosha. And for this, the treatment is Shirobhyanga. It means it is a massaging of head, neck, and shoulder with warm Ayurvedic oil to pacify the dosha Vata, Pitta, and Kapha. It balances all the three doshas.
So the importance of Shirobhyanga is it regulates regular regular scalp massaging and hair oiling. It cannot help only to rid the scalp accumulation, but also can help resolve issue related to sensory organs, body and mind. So the benefits of Shirobhangas are it reduces the hair fall and stimulates hair growth. It soothes itchy scalp and reduces the dandruff. It reduces. It also reduces the split ends and control freeze. It also improves the scalp blood circulation, and it can also help in relieving the headache and everyday stresses. It also rejuvenates the mind. So how it helps in daruna as well as also mind and headache. Also. Thank you.
Thank you, doctor. Next, I invite Dr. Pradisha Gorak Palve for the poster presentation.
Yes, sir. Good evening, sir.
Good evening, doctor.
Can you share my PPT, sir?
Okay, doctor. 1 minute, doctor. Doctor, screen is visible, doctor.
Yes, sir. Good evening, all of you. Myself, Dr. Pratiksha Palwe, second year PG Panchakarma Department from SMBT Ayurved College, Igatpuri, Nasik. My guide name is Anushri Endait, ma'am. My topic name is benefits of Matra Basti in Gudrasi. Gudrasi sciatica, according to Acharya Charak, Gudrasi is mentioned as one of the most important among the 18 types of Vata Jnanatmaj Vyadhi. Gudrasi word itself describes that is Gudra means vulture like walking. Matra Basti, Eteshta Hara Chesashta, Sarvakal Nirattaya, Rasvaya Sneha Matraya, Matra Basti Samabhaveta, Charak Siddhistan 453. Administration of Sneha oil through rectal route in 60 ml amount. Benefits of Basti are Vayasthapanam, Agnivardanam, Ruchikaram, Manabuddhi Prasadanam, Indriya Prasadanam, Lagutva in Asha Prakriti Sthapanam, hence to promote health and prevention of disease. Basti is done in Varsha Rutu. Thank you, sir.
Thank you, doctor. Next, I invite Dr. Shubham Jani for the poster presentation. Dr. Shubham Bilasman, are you there? Hello, Dr. Shubham Bilasman, are you there? Hello, Dr. Shubham Bilasman Jani, are you there? Next, I invite Dr. Janvi for the paper presentation. Dr. Janabi Naneshwar Chinde for the paper presentation.
Yes, sir. Am I audible?
Yes, doctor. Audible, doctor. Please share the screen, doctor.
Yes. Hello.
Hello, doctor.
Yes, doctor.
Hello.
Hello, doctor. Your voice is clear,
Yes,
doctor.
doctor, you're audible.
Sir, there is problem in sharing screen.
Okay, doctor. 1 minute, doctor. I will share for you.
Yes, sir.
Doctor, please start the session, doctor.
Okay, thank you, sir. Good evening, everyone. Myself, Dr. Janvi Shinde. Yes, sir. First, we will see about iron deficiency anemia. In PBS of iron deficiency anemia, we see microcytic hypochromic red cells and pencil cells. Microcytic, we compare the size of RBC with the smaller lymphocyte. So if it is smaller than a small lymphocyte, then we called it as microcytic. Hypochromic means central pallidness is more normal, and lab investigation of iron deficiency anemia shows low HB, low PCV, low MCV, and low MCSC. That is red cell distribution width, and serum ferritin is less than 15 milligram per DL. Next slide, sir. This is the picture of iron deficiency anemia. Next slide. Iron deficiency anemia is differentiated with thalassemia because PBS of both anemias are same. Iron deficiency anemia shows RBC count low, and in thalassemia there is normal to increase RBC count. RDW in iron deficiency anemia is increased, and in thalassemia it is normal. There is structural hemoglobinopathy in iron deficiency anemia, and there is quantitative hemoglobinopathy in thalassemia. Both have the presence of target cells in their PBS. Next slide. Thalassemia, it is inherited disorder characterized by reduced or absent synthesis of alpha and beta globulin polypeptide chains. It has two types, alpha thalassemia and beta thalassemia. Beta thalassemia major and beta thalassemia minor. It is differentiated with lab investigation and PBS. Beta thalassemia major MCV, also low MCSC, but in minor, low MCV and MCH, but not MCSC is normal. This is the picture of beta thalassemia major. Hello.
Yes, doctor, you're audible. Please continue.
Next is megaloblastic anemia. It results from either folate or vitamin B12 deficiency. Normally, RBC is a disc shape. We call it as a discocytes, but in megaloblastic anemia, it is oval and microcytic. Means size of RBC is more than normal, and second, basophilic stippling and Howell jolly bodies are seen. Difference between megaloblastic and non-megaloblastic microcytic anemia. Microcytic anemia shows round microcytosis, where megaloblastic anemia shows oval microcytosis. There is no hypersegmentation of neutrophils, and causes of megaloblastic microcytic anemia is chronic alcoholism, obstructive liver disease, and microcytosis is physiological in newborn due to high HB and a high. Next slide, sir. Anemia of chronic disease. There is a normocyte. We can see anemia in CKD and other chronic diseases. Sideroblastic anemia. Heme synthesis is deficient in sideroblastic anemia. There is dimorphic anemia, means both normocytic and microcytic picture of RBC can be seen. There is basophilic stippling, polychromatic red cells, and ring sideroblasts can be seen in PBS. Next slide. Aplastic anemia. It is characterized by pancytopenia. Pancytopenia means all the cells of blood is reduced. Red cell, leukocytes, and platelets are decreased in number, and decreased cellularity of bone marrow. Glucose 6-phosphate dehydrogenase deficiency. Acute hemolysis, and this acute hemolysis presented with bite cells and hemighost cells in PBS. Next is autoimmune hemolytic anemia. It has two types. Warm antibody type autoimmune hemolytic anemia shows spherocytes, polychromasia, and late normoblast. Spherocytes means there is no central pallor in RBC, which is normal in PBS. And polychromasia means different colors of RBC are seen. And normoblast is a stage of RBC formation, which is delayed in this type of anemia. Next slide. Which is autoagglutination. It's like a Rolex formation, but it is characterized by acrocyanosis, which is cyanosis of nose, ear, and toes. And last one is microangiopathic hemolytic anemia, which shows the cystocytes, that is fragmented red cells in PBS, some spherocytes, and polychromatic red cells. Thank you.
Thank you, doctor. So next I invite Dr. Reena. I invite Dr. Reena. Dr. Reena, are you there? If so, please respond. So next I invite Dr. Rubali Keshav Rao. I invite Dr. Rubali.
Hello.
Hello, doctor.
Good evening, everyone. Should I share my slide?
Yes, doctor.
I'm sorry, I'm
Dr.
unable to share
Rupali?
it. Would you please help me?
Okay, Dr. Rubali, I will help you. I will share the screen for you. Doctor, please start the session, doctor.
Hello, good evening, everyone. Myself, Dr. Rupali Keshwara Hanavte, PG Scholar, Komarbrute Department, GSC Nanded. The topic of my presentation is study of Ulvaparimarjan with special reference to cleaning of vernix caseosa, guided by Dr. Dattatreya Chauhan Sir, Associate Professor, Komarbrute Department, GSC Nanded. Next. The outline of my presentations are introduction, aim and objectives, material and method, Ulva and procedure of Ulvaparimarjana, vernix caseosa, discussion and conclusion. Introduction. As per Ayurveda, Ulva Vishodhanam or Ulvaparimarjan is one of the important steps in Navjat Shishu Paricharya, where Ulva means vernix as we compare it. Vishodhanam means malaxation, that is an act of softening by mixing with thinner substances. Okay. Sometimes hospital staff wipe the vernix completely with normal saline or with sterile water swab, but WHO recommends leaving vernix intact on the skin surface after birth due to its benefits such as barrier to water loss, temperature regulation, and innate immunity. Here is a way of adopting a low-cost newborn-friendly bio-intervention of Ayurvedic method of cleaning of vernix caseosa so as to preserve the skin integrity of the neonate, promote and protect optimal skin function. Next. So what are the aim and objective we learn here? Aims is to study of Ulvaparimarjan. Objectives are to dry and stimulate the respiratory system of the newborn, to study the benefits of vernix caseosa to newborn, and to learn the skin of the newborn. Clean the skin of newborn. So what is this white cheesy thing on the baby skin? So here we call it a ulva. The word ulva is a Sanskrit word meaning covering, envelope, especially the membrane surrounding the fetus. Dalan also give the reference over it. Jarayu ulbakaro, ena vishrita, pranino jayante. The most commentaries of Ayurveda, ulva means membrane covering the embryo. That is mentioned here, pranino jayante, that means covering the embryo. White thick substance covering the embryo in utero or on the skin of this newborn baby. And it is also given their etiology where it is called as a ambupurna roga, that is given as a from amniotic fluid. Next. So our Jatmatra Paricharya, our acharyas also given that Charak Sahita, in Charak Sahita, we got a Pran Pratyagaman, Sushu Sahita Mukha Vishodhan, and Ashtang Hruday gave told us about Ulva Parimarjana. We learn here Ulva Parimarjan here. Next. Next. So what is Ulva Parimarjan? Ashtang Hruday gave reference over it. Jat Matra Vishodhyal Valam Sendho Sarpisha Prasuti Kleshitam Sa Anubala Teleno Sechet. अथ खलु जातमात्रमेव बालमूलवात सेंधो सर्पिशा marjet. Vagbhata holds similar view and described that cleaning of ulva from the skin, a baby's mouth and body should be performed immediately after birth using rock salt and ghee, that is sendho sarpi mixture, and further to massage the baby with bala oil, which provide relief from birth stress. Next slide. Sushruत Sahita also give reference over it. Atha jatasya ulbamaniya mukham cha sendho sarpisha tato balatelena abhyanga. Acharya Sushruत opines that ulva of babies should be cleaned immediately after birth by the mixture of sendho, lavan and sarpi. So procedure of ulva parimarjan, newborn baby. We apply the mixture of sendha and the ghee and parimarjan with balatel abhyanga. The procedure of ulva parimarjan. So for this, we perform it on the dry, clean and warm place, and baby should be received in the warm cushion based tray, or else the baby will lose heat through conduction method. Newborn is placed in supine or on one side position with head slightly low position. In the wall, take pre-warm liquefied cow's ghee and sendhav lavana. It becomes fine emollient. This mixture uniformly apply on the newborn baby's skin from neck to down. Apply carefully in the folding of the skin, axilla, and groin region, and around eyes also. Rubbing gently to remove the blood stain, amniotic fluid, meconium stain, and this also helps in softening the adhesive property of vernix caseosa. It allows loosening the grip and getting the residue cleaning off with maintaining the moisture. Care should be taken in and around the umbilical stump. During the procedure, observe Abgar score also, and after Uloparimarjan, perform the Abhyanga with Balatel. Next, please. The benefits of Uloparimarjan. Benefits of malaxation and cleaning with the Sendho Sarpi mixture are discussed below. Ayurveda considered ghee as Mangalya, Pavitra, and Saugandha. And rock salt also contain 85% of sodium chloride and 15% of trace minerals. So we compare this ulva with vernix caseosa. So what is vernix caseosa then? Vernix means to vanish and caseosa means cheesy-like. So it is a white, cheesy, creamy, naturally occurring biofilm covering the skin of the fetus, naturally occurring complex lipid-rich substance covering the skin surface. This protective substance is secreted by baby's sebaceous gland, that is slug of skin cell. Vernix serves to conserve heat and protect the delicate newborn skin from environmental stress. So this is the composition of vernix caseosa. It is made up of lipid and amino acids. So biology of vernix caseosa, how it made. So this is the line we show is the epidermis of the baby's skin, and upper is the vernix. In utero, the shed periderm cells are mixed with the sebum secretion from the sebaceous gland, and it interacts with the pulmonary surfactant, and it detaches into amniotic fluid, and it also gives the uniform cover over the baby's skin. Somewhere it also get swallowed in the gut. So what are the benefits of vernix caseosa? The first one is the protection. What are the protection? It gives the skin surface adaptation after birth, antioxidant, anti-infective property, wound healing and moisturizing property. It also gives easy passage and preparation of breastfeeding and digestion at the birth, and thermal regulation at birth. So what are the moisturizing properties here? So vernix caseosa has a high water content. So when it broke down, that the filament aggregating protein, when it broke down, it formed the water binding molecule. That's why it is very it has very moisturizing property. And the thing we apply over it is ghee, cow ghee and sendham. The ghee also has snigdha, pishchil and sukshma guna, which help in the moisturizing property also. Second one is the antioxidant property. Vernix is said to have the antioxidant property due to the presence of vitamin E and melanin in it. And butter, we called it as it has triglyceride, diglyceride, monoglyceride, phospholipids contain the carotene, vitamin E, which are known as antioxidants. It prevents the hypothermia and insensible water loss also. So in the newborn baby, it has a large body surface area. So the water, so the heat on the water loss will be more. So this will help to prevent from this, and they also help to not to get hypothermia. And anti-infective property, vernix like the epidermis contain antimicrobial peptides and has the direct role in defense against bacteria, and the mixture act as an antimicrobial, and cow ghee is also has the rakshoguna properties. Next, please. Wound healing properties. Vernix has shown to increase the skin metabolism in vitro by increasing the glucose consumption and lactate production. The regulation of transepidermal water gradient is known to be important in the epidermal barrier formation and regeneration following wounding. Because of the Ropenguna, that is healing property, and Ranahar property of ghee, effective in the wound healing, skin tears, and birth trauma. And next, provide stimulation and increases peripheral circulation. So the baby's strongest sense of birth is a sense of touch. When the skin is gently aroused through the malaxation, many tactile receptors are stimulated. This impulse stimulate tactile receptors that encode touch information before sending it to the central nervous system and the brainstem. Through the brainstem, tactile information is widely distributed throughout the brain. So WHO also give recommendation over it. According to WHO, newly born babies who do not breathe spontaneously after thorough drying should be stimulated by rubbing the back 2 to 3 times before clamping the cord and initiating positive pressure ventilation. So discussions in Ayurveda, Acharya mentioned use of Grita, which is bad conductor of heat, may give sufficient protection from hypothermia. Vernix gaseosa can be present more in the preterm while less or may not be present in the postpartum babies. It serves to conserve heat and protect delicate newborn skin from environmental sting. Traditional practices has directed to wipe Vernix gaseosa from the skin as it considered preferred method for drying and stimulation of respiratory efforts. So what is the conclusion here? Balatel Abhyanga is advised after Ulvaparimarjan. Touch is believed to improve neuromotor development of baby by sending stimulatory signals to the brain. There are many opinions regarding to remove vernix gaseosa or not, but at birth, newborn skin is covered with vernix as well as meconium, blood stain, amniotic fluid. Hence, it is better to clean this with the head and neck region and complete body. Therefore, one should not rush to clean the vernix gaseosa immediately. It should be clean, but if we are going to remove that protective covering from the babies, so we should apply another covering that we called as Sendho Sarpi, so that it will not cause any other problem to the baby and will give all the protective layer that we need. These are the references that I use for the presentation. Thank you, everyone.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Priya Belkhare. I invite Dr. Priya.
Thank you, ma'am. Thank you, doctor. I share my PPTs. Is that slide is visible?
No, doctor, not visible.
Right now?
No, doctor, it's not visible.
Wait a second, doctor. Now,
No,
now is
doctor,
it,
not visible, doctor.
Doctor, can you please share my PPTs?
Okay, doctor, I will share for you, doctor. 1 minute, doctor.
Okay.
Doctor, please start the session, doctor.
Wait a second. Thank you, doctor. Good evening, everyone. Myself, Dr. Priya Belkade, second year PG scholar, Rachna Shari Department, Government Ayurvedic College, Nanded. My presentation topic is a case study on importance of Marma Chikitsa in Avabahuk. Next, aim and objectives. Aim to study the importance of Marma Chikitsa in Avabahuk. Objectives to study the Amsamarma, to study the Avabahuk, to study the Marma Chikitsa, to study the structure present over the shoulder region according to the modern science, to evaluate the importance of Marma Chikitsa in Avabahuk. Next. Review of literature. Marma. We only know the definition of marma, that is Marianti iti marmani. Injury to the marma sthan may lead to the death. According to the Ashtang Hridaya Sharistan 4th 37 shlok, Vishamam spandanam yatra pidite ruka shcha marma tatah. The point where irregular pulsation and the pulse and pain is felt upon the pressure are called marma. Sense of pain or intensity of pain will be more at the location of marma compared to the other part of the body because Chetna is situated in the marma sthan. Marma classification. As per Rachnatmak aspect, there are 5 types: Mans, Sira, Snayu, Asti and Sandhi. Amsa marma is included in the Snayu marma. Next. As per the Parinamatma aspect, Sadhya Pranahara, Kalantara Pranahar, Vaikalyakar marma, Vishalyakar marma, Rujakar marma, and some marma is included in the Vaikalyakar marma. As per Praman aspect, Ek Angul, Dvi Angul, Trayangul, Swapanital, Ardha Angul. Amsa marma is included in the Ardha Angul Praman. As per location or sthan aspect, Shakhagata, Ura and Udaragata, Prushta marma, Urdhva Jatrugata marma, and the Amsa marma is included in the Prushta marma. Amsa marma. Amsa marma, that is shoulder. It is 2 in number, 1 on each shoulder. It is included in the Snayu marma. It is half anguli in Praman. According to Acharya Vagbhat, 4/25, the site is Griva Ubhayatah Snavani, Griva Bahu Shiro Antare, Skanda Ansapita Sambandha Anso, Bahu Kriya Haro. According to the Acharya Shusha Sharistan 6/26, Bahu Murdha Griva Madhe Ansapita Skanda Prabandhana Anso. Next. Next. Qualities. It is a Vaikalyakar marma. It causes disabilities. Then if it injured, then symptoms occur. According to the Acharya Shishresh Sharistan 6/26, Stabda Bahutakar, and according to the Acharya Vagbhat Sharistan 4/25, Bahu Kriyahara occur. Injury to these muscle and the ligament will result in disability. Next. Anatomical structure. The anatomical structures present over the shoulder regions are trapezius muscles, then suprascapular artery and vein, scapula bone, coracoacromial and the suprascapular ligament, phrenic nerve, third and the fourth cervical nerve. Modern aspect. Frozen shoulder. That is a condition characterized by stiffness and pain in the shoulder joint. Then swimmer shoulder, shoulder pain
caused by connective tissue or a tendon rubbing on a shoulder blade. Rotator cuff tendinopathy, that is swelling of tissue or a tendon connecting the muscles and the bone in the shoulder. Up palsy, it is a form of the brachial plexus palsy. It is a condition characterized by arms weakness and loss of motion. Klumpke palsy, it is also a form of brachial plexus palsy, paralysis of arm due to an injury of network of spinal nerve. Avabahuk. Avabahuk, it is coined by Acharya Shushrut as a disease of Skanda. According to the Acharya Shushrut, Nidan San 1/82, Ansadesha, Stito Vayu, Shoshitva, Ansabandhanam, Sirashcha Akunchana Tatrasto, Janayata Avabahukam. Vitiated vat in and around the shoulder cause shosh of ansabandha, that is shoulder ligament, tendon, then connective tissues or the capsule leading to the pain and the stiffness, and constrictions of blood vessels, that is reduction blood supply, is termed as the avabahuk. According to the Acharya Vagbhat, the condition in which the vat get lodged at the root of the shoulder, subsequently constricting the vein and producing the loss of movement of the shoulder, is termed as avabahuk. Next. Marma Chikitsa. Manipulating or stimulating marma in the management of various diseases is known as Marma Chikitsa. Marma Chikitsa, which is also designed as mother of all healings therapies, because of one sitting of marma therapy can really bring marked relief. Many people have tried this therapy and got relief from the pain in a very short span of time. Though stimulation of marma by various methods, the pran existing in marma may be directed to remove blockage and stimulate energy flow, thus resulting in a state of healthy mind, body, and spirit. Case report. A 58-year-old female patient visited the OPD with complaint of pain, restricted movements in the right shoulder since 2 months. The pain usually was aggravating with the movement of the shoulder and was being relieved after intake of analgesic or with the hot water fermentation. Gradually, the condition worsened and shoulder joint movement was restricted. Patient data: name, age was 58 year, sex female, height 5.5, weight 70 kg, address Wazirabad, Nanded, occupation housewife. The present complaint, Dakshin Hasta Shula and Dakshin Hasta Graha since 2 months, hypertensive since 6 to 7 years, and there is no any surgical history. Chikitsa given that lady, the pressure should be optimal with the contact time for 0.8 second. It should be repeated for 12 to 20 times in one sitting. Marma Chikitsa should be done mostly in the morning hours and the evening hours. Continuous and repeated stimulation for a long duration, which may be from few days to the year. Doctor, can you please play the video?
Doctor, this video is not supported, doctor. Hello, doctor.
Yes, doctor.
This video is not supporting, doctor.
Okay, next slide. Assessment criteria. Lakshan, Hasta Shulab or pain. Before treatment, it was 3, and after treatment, it is 0. Hasta Graha or stiffness. Before, it was 2, then after, 0. Stabda Hasta or restricted movement. Before treatment, 2, and after treatment, 0. Next. Discussion and conclusion. Marma Chikitsa in Avabahu was found to be highly effective in most of the parameter of assessment. Significant changes were observed: reduction in pain, increase in ROM, flexion, abduction, external rotation, internal rotation, reduction in joint stiffness. Next, please. Amsa marma, at the Snayu marma, Vaikalyakar marma with a half anguli in measurement present at the shoulder joint. Injury to this region results tabda bahuta, that is pain or stiffness, consequently leading to Vaikalyata if not treated properly. So knowledge of the Amsamarma will help to the physician surgeon to prevent the structural or the functional deformity of the limbs. Marma therapy is a promising fast-acting, cost-effective, rapid action, less time-consuming, easy to use and non-invasive alternative methods for treatment of Avabahu. Thank you.
Thank you, doctor.
Thank you, doctor. So next I invite Dr. Shubham. I invite Dr.
Hello, Dr. Shubham.
Yes, sir. Dr. Shubham here.
Okay, doctor. Please share the screen, doctor.
Wait, sir.
The screen is visible, doctor. Please chat.
No, sir. Just a minute, sir.
Okay, doctor.
Sir, can you share my slide, sir? I'm unable to share my slide.
Okay, doctor. I will share, doctor.
Okay, sir.
And doctor, I will call you next, doctor. Okay. Please wait, doctor.
Okay, sir.
And next I invite Dr. Shubham Bilas Pandjane for the paper poster presentation. Dr. Shubham Bilas Pandjane, are you there?
Yes, sir. Okay, sir.
Okay, doctor.
Good evening, everyone. Hello.
Hello, doctor. Your screen is visible, doctor. Please chat, doctor.
Good evening, everyone. Myself, Shubham Vilas Raujane, PG second year student, SSMBD Ayurved College, and my guide is Dr. Anil Wak. And my topic is role of Katibasti in the management of Katigraha. Introduction. Katigraha is a condition where low back region is affiliated with vitiated vata and present with symptoms such as pain and stiffness. Katibasti. Kati means low back and basti means to hold. Katibasti is a treatment in which medicated oil are poured and pulled for a fixed duration of time in a compartment or a cabin constructed over the low back using wet floor of black gram, covering the lumbosacral and sacroiliac joints. Katibasti is a pain relieving oil pulling treatment conducted for low back pain. Mode of action of Katibasti. Katibasti is a combo therapy comprising of synchronized Snehana and Svedana. It helps to relieve the inflammatory changes, to relieve the spasm, to strengthen the supportive tissue, for holding the spine, nourishing the joints through improving the circulation. The structure involved at lumbosacral regions are nerve muscles, vessels, articularies. Role beneficial for the strengthening the low back muscles, in increase blood supply for lumbar muscle, nourishes the lumbar and sacral vertebra. It increases nerve supply to the lower limb, stimulate nerves, relieving pain and numbness, elevates pain associated with fracture, dislocation, spinal tuberculosis, and tumors. Thank you.
Thank you, doctor. Next, I invite Dr. Vrushali. Hello, Dr. Vrushali.
Yes, ma'am.
Dr. Vrushali, please share the screen, doctor.
Yes, sir.
Your screen is visible, doctor. Please
Can I
chat.
audible?
Yes, doctor. Audible, doctor. Please chat, doctor.
Good evening, sir. Myself, Rushali Balpande, a second year student, Rashasastra and Bhashishya Department, BMAM, Nagpur. My topic is role of Prasha Aushadhis and their effect skin diseases. Introduction. The skin covers the external surface of the body and is the largest organ of the body. In Ayurveda, Tvacha word is used for skin. Tvacha is derived from Tvaka dhatu, which means the cover. According to modern medicine, skin contains sweat gland, blood vessels, hair follicles, erector pili, which are responsible for proper functioning of skin. As per Ayurvedic literature, imbalance of three dosha and dhatus is responsible for skin diseases. Doshas are three fundamental energies in our body. Large populations have various skin problems. Need of the study. In today's era, the skin diseases becomes very common and serious issue. The prevalence rate of skin diseases in India is 10 to 12%. Ayurveda has described many skin diseases under the Kushta, which is Sridoshas Vadi. The Samprapti of Kushta is started from Rasa Dhatu and travel onwards to another Dhatus, which increases the chronicity of diseases. There are many formulations described in Ayurveda to treat skin disease. As the skin diseases are difficult to treat and require long-term treatment, the medications which gives fast effect in small doses form should be used. Rasadhatus fulfill both the criteria, so it is good to use in the skin diseases. Aim, role of Prasha Aushadhis and their effects in skin diseases. Objectives are to identify the various Rasa Aushadhis which is given in Kushta, to review the role of different Rasa Aushadhis in various skin disorders. Kushta, word Kushta means a pathological condition which displaces the skin. Skin is an important organ of communication with the external world. Skin is the largest area of the body. It reveals both the normal and pathological state of an individual. There are total 18 types of Kushta under the term Mahakushta and Shudra Kushta. Types of psoriasis. Sampraptis Nidan 7 leads to Tridosh Prakop, leads to Tvaka Rakta Mams and Ambu Saitilya, leads to further mutation of doshas occur, leads to doshas gets accumulated and the place of Dhatu Shaitilya, leads to dosh and dushya samurchana causes kushta. Rasa Aushadhis in various Rasa Aushadhis are used for the Kushta Chikitsa. Here is the review of Rasa Aushadhis which is given in Kushta Chikitsa from the Rasaratna Samuchay. Name of the formulations: Vijayavati, Tripurantak Ras, Yoshadi Gutika, Kushtanashan Ras, Swarnakshiri Ras, Chandraprabhavati, Shvetari Yog, गंधधिकारा गण पुष्टक्षर ब्रह्मा रस चंद्रनानव रस चंद्रकांती रस अर्केश्वर रस Suprakushtari rasa. Doses and anupan are given. Uses in Shvitra, Kushta, Kushtakutar ras. Use in Kushta. Anupan is Imbadik Vat. Khageshwar ras, Narayan ras, Dhanvantari ras, Kasibada ras, Triko Vijay ras, Shitrari ras. किलनाशन रस, उदवदिद्य रस, श्वित्रांतक रस, प्ररीत रस, जातुग्निवटी, कुष्टांत परपटी, श्वित्रकुष्टारी रस, सर्वेश्वर रस, कुष्ठनाशन रस, मेडिसिनल रस, विसर्पाजित रस, कृष्ण माणिक्य रस, हरिबोलांकुश रस, कुष्ठकुटार रस, महातलेश्वर रस, आरोग्यवर्धिनी वटी, वज्रधार रस, सर्वेश्वर रस, माणिक्यवटिक रस, महातलेश्वर रस, दद्रु विद्रवान रस. Discussion and conclusion. There are so many formulations described in Rasaratna Samuchay which are used in management of skin diseases. Kajal is the most commonly used form of mercury in formulations, maybe due to it contains more free sulfur than other kalpas. Gandak and its compounds are used more in management of skin diseases. Hartal is used in later stage of skin diseases. Hence, Rasa Aushadhis gives relief from symptoms of skin diseases and may have great role in management of skin diseases. Limitations. Many of the formulations are unavailable in market, so it is need to manufacture such formulations and check them for their therapeutic efficacy. So it will be born for Ayurveda. There was many study conduct on the toxicity of Rasa Aushadhis. Later, it's proved that toxicity can happen due to various factors, but when medicine is prepared authentically, so no toxicity seen in the Rasa Aushadhi. References are given. Thank you.
Thank you, doctor.
Thank you, ma'am.
Next, I invite Dr. Tansi Gautam. I invite Dr.
Dr. Shubham, are you there? Dr. Shubham Tansingh Gautam, are you there? Hello, doctor.
Good evening, sir.
Okay, doctor.
Hello, sir.
I will share for you, doctor.
Audible, sir?
Audible, doctor.
Okay.
Doctor, please start, doctor.
Good evening, everyone. Myself, Dr. Shubham Gautam from Government Ayurved College, Nanded, second year PG scholar, Department of Komargrutyam. My topic of presentation is Vicharchika in children, guided by Dr. Devkumar Rao sir, assistant professor in Government Ayurved College, Nanded, Komargrutyam Department. Introduction. Vicharchika is a type of Shudrakushta often encountered by Ayurvedic dermatologists, characterized with symptoms namely Kandu, Strava, Pidika, and Shavavarna. In the Ayurvedic text, all skin diseases were included under the Kushta Rog, which is classified in two divisions, that is Mahakushta and Shudrakushta. Vicharchika is described under the Shudrakushta. The clinical presentation of Vicharchika similar to eczema in modern dermatology. Eczema, also called atopic dermatitis, is characterized by dry, itchy skin with areas of poorly demarcated erythema and scale. Ayurveda offers treatment for the root of eczema by cleansing vitiated dosa and balancing the dosa and dhatus. In pediatric practice, 1/3 of the patients with skin disease are atopic dermatitis. Next slide, sir. Classical definition of Vicharchika according to our ancient acharyas. According to Charaka, Sakandu Pidaka Shava Bahustrava Vicharchika. It is a skin alignment wherein eruption over the skin appear with dark pigmentation, itching, and with a profuse discharge, seen in pictures. According to Sushrusahita, Rajyavati Kanduruja, Saruksha Bhavanti Gatri. Next slide, sir. According to Susrusaita, Rajyoti Kandu Ruja, Saruksha Bhavanti Gatresu, Vicharchikaya. Kandumati Daharuja Papanna Vipadika Padagate Meva. It is a condition in which the skin has a linear relation with intense itching and pain, but when the same itching, burning, and pain experienced in the pit alone, it is termed as a vipadika. According to Acharya Vagbata, Sakandu Pidaka Shava, Lasikadda Vicharchika, Parusam Tanu, Raktamantam, Shavasanu Unnatam. The blackish eruption with intense itching and watery discharge, that is Lasikadya, is referred to as a vicharchika. Next slide, sir. Nidana, causes, etopathology, Mityahara and Mityavihara. First, we see it Mityahara. First, exercise use of Navana, Dadi, Masya, Amla, and Lavana. Excessive use of Tila, Kshira, and Guda. Excessive oleation. Continuous and excessive use of Madhu, Hanita. Intake of food during indigestion. Asatmya Ahara, Adyasana. Intake of polluted water of Vicharchika. Next slide, sir. Mithya Vihara. To do physical exercise and to take sun bath after heavy meals. To do exercise after Snepana and Panchakarma. Sudden change from cold to heat or heat to cold without judiciously following the rules of gradual changes. Entering into the cold water immediately after one is affected with fear, exhaustion, and sunlight. Next slide. Veg Vidharna. Suppression of the urge of mimesis, withholding of the natural urge, that is Mutra and Purisvega, generally school-going children. Panchakarma Apcharana, Panchakarmani Kriyamani Nishiddha Sevanam, improper administration of Snepan therapy. Next slide, sir. Purvarupa Vicharchika. There is no illustration regarding the premonitory sign and symptom of Vicharchika in the text, but as it is classified as one of the Kshudra Kushta Roga, so one can take the premonitory syndrome of the Kushta Vadi to that of Vicharchika. Next slide, sir. Rupa of Vicharchika. According to Susruta, Kandu, Rajyo, Ruja, Rukshitha. Rajyo means there is a reddish discoloration of the skin. According to Ashtang Rudaya and Ashtang Sangra, Kandu, Pidika, Shava, Strava. Strava means discharge. Next slide, sir. Samprapti of the Vicharchika. Samprapti means the pathophysiology of Vicharchika, according to the Ayurveda. In classics, there is no separate description regarding the Samprapti of the Vicharchika, but being a variety of Kushta, the common Samprapti of the Kushta should be considered. Samprapti Ghataks. Samprapti Ghataks means the factors which cause the pathogenesis of the Vicharchika. Dosas, Tridosha, Dushya, Twaka Rakta Mansa, Lasika, Strotas, Rasa Rakta Mansa, Udakva, Agni, Jatara Agni and Dhatva Agni Mandya, Strotodushti, Sanga and Vimargagaman, Sanchara, Triyaga Sira, Adhishtana Twaka, Rogamarga Baya, Sobhava, Chirkari. Next slide, sir. Patya and apatya in the Vicharchika means what to do and what to avoid in Vicharchika. Patya. Lagu Anna, Tikta Shaka, Puran Dhanna, Jangal Mansa, Patola, Mudga, Tripala, Nimba, Grita. Next slide, sir. Apatya. Guru Anna, Dugda, Dadi, Amlarasa, Guda, Tila, Anupamansa, Masya, Mansan Vasa, Taila, Mas, Kulatta, Ikshuvikara, Mulaka, Madhya, Lavana, Vidayanna, Abhishandhyanna, Vishtambhyanna. Next slide, sir. Sadhya Sadhya Vicharchika. Regarding prognosis, Acharya have stated that the disease of the Kushta appearing in a person who has a full control over his sense organ and confined only to Tvaka, Rakta and Mandhatu of the body, involving Vat and Kapha dosa, should be regarded as a curable and can be eradicated completely. Means disease which up to the Mandhatu is sadhya according to the Ayurveda. In case of one whose infection is penetrated into the fatty tissue or adipose tissue, that is meda according to Ayurveda, is apnea. Yapya requires palliative treatment and is never rooted out. In case when infection has reached the bone marrow or semen or ovum, or which is cause of the three those together, or any kushta having the complication are incurable, means three those kushtas are asadhya, means incurable. Next slide, sir. Continuation. As a Twaka, Rakta, and Mans Dhatu are generally vitiated in the disease Vicharchika, so it may be counted under the category of Sadhya Kushta. Charaka in Nidanstan 5 Adhyaya 9 Sloka has stated that the improper regimen leads curable disease and incurability. Hence, proper measures should be carried out at the early stage of the skin disease. Next slide, sir. Upadrava means complication. In Charaka Nidan Sthana 5th Adhyaya 11th Slok, the following complication of Kushta have been described. Uyastravam, Angabeda, Trishna, Jwara, Atisar, Daha, Dorbalya, Arochaka, Avipaka. Next slide, sir. Chikitsa of Vicharchika means treatments. The line of treatment of the disease has been mentioned under the heading of Chikitsa Sutra in the classic text. There is no special description available in Sahita regarding the Chikitsa Sutra of Vicharchika while explaining the general line of treatment. Acharya Charaka stated that all kushta are caused by the three dosa, so the treatment is to be carried out according to the predominance of dosa. The predominantly vitiated dosa should be first elevated, other subordinate dosa should be undertaken afterward. Next slide, sir. Continues. Beside the classical reference, the treatment of the kushta can broadly be classified into the three methods of management. This is Shodhan, Shaman, and Nidan Parivarjan. Shodhan further classified in three categories: Anta Parimarjan, Vai Parimarjan, and Sastra Paridhana. Anta Parimarjan means internal medicine, Vai Parimarjan means the external application, and Sastra Paridhana is the surgical management. And other two is Shaman and Nidan Parivarjan. Next slide, sir. First, Shodhan Chikitsa of the Kushta. For Shodhan Chikitsa, Vyadhi Bal and Sharir Bal in pediatric patient are important because most of the Shodhans are contraindicated in pediatric age group. So, before starting the Shodhan treatment, must check out the Vyadhi Bal and Sharir Bal of the patient. Then start the Shodhan Chikitsa. Acharya Charak mentioned the Chikitsa Sutra of Kushta. This is the that is Vat Uttaresu Sarpi, Vamanam Slesma Uttaresu Kushtisu, Pitta Uttaresu Moksha Raktasya Virechanam Cha Agre. In Shodhan therapy, Vaman, Virecha, and Raktamokshan are indicated. Acharya Charaka has specified that the Kushta where Vata is dominant, Grita should be prescribed. Similarly, where the Kapha is dominant, Vaman Karma, and in the dominance of the Pitta Virechan, Karma and Raktamokshan should be instituted. Susru described the line of treatment of the various kushta in somewhat similar to the Charaka's description. Next slide, sir. Continuation. Pakshata Sardanya Upayona Masata Masastranam Chapideyam Stravyam Raktam Vasrehi Durelpam Nasam Dadacha Tri Ratrata. Means this is a Susru Chikisastan 9th Adhyaya 43 Sutra. He stated that the Panchakarma, in what duration we will be started in the Kushta patient. He said that the woman for Kabadika Kushta in every fortnight, Virechan for the elimination of vitiated pitta should be undertaken every month. Raktamokshan for the expulsion of the Dushita Rakta should be done twice in a year, means 6 months, once in a 6 month, and Nasyakarm should be carried out on every 3rd day. Susrut has again mentioned the principle of treatment of the kushta is as follows. Susrut Chikitsa 9th Adhyaya 6th Sutra. In Twakagat means Rasagat Kushta Shodhan, and drug should be applied as external application. In Raktagat Kushta, Shodhan Karma, Kashayapana, and Raktamokshan treatment will be given. In Mansagat Kushta, Shodhan Karma, Alepan, Kashayapana, Raktamokshan, Asav, Arishta, Manta Kalpana and Avle preparation has been indicated. Next slide, sir. Continuation. In Medugat Kushta, Sanshodhan, Raktamokshan, and Bhallatak, Shilajut, Gugul, Tuvara, Khadira, Asan, and Ayaskruti has been indicated. According to treatment given up to only the Medugat Kushta as a further Kushta is Asadhya, up to the Mazgat Kushta Sadhya, and Medugat Kushta is Apta. According to Acharya Vagbata, that Kushta should be treated first by the Sodhan, means before starting the treatment of the Kushta, first treatment start from Sodhan and then next Shaman. Through internal and external purification, and Shaman drugs should be prescribed thereafter. In Bhel Sahita, Vicharchika has been mentioned as one of the Virechya group. It reveals that Acharya have favored to conduct the karma Virechan in Vicharchika. In Vidhi Sunita Adhyaya of Sutrasthana, Acharya Charka has mentioned, sir, back sir please. In Vidhi Sunita Adhyaya of Sutrasthan, Acharya Charka has mentioned Kushta as one of the diseases of Sonitastra Roga, and Virechan has been stated as one of the measure for it. Continue. Shaman Chikitsa. It is given with two specific purposes: to subside Kushta in those patients who are unable and contraindicated, like in children for Shodhan Karma, to subside the remnant dosas after Shodhan Karma. Charak and other Acharya have given various yoga to be used as a Shaman yoga, mainly Khadira, Nimba, Patola, Tripla, etc. are used in the various form in Kushta, like Mahamanjishta Dikot, Arogyavardhini Vati, Khadira Restatis. External application like the biparimarjan in the purification of the body by applying various drugs to the skin. Mode of parimarjan may be lepa, parishek, auchurna, abgharshan, etc. Hence, Charka and Vagbata has described lepan external application on skin lesion after performing Sodhan or Shaman therapies in the patient of the Kushta provide early relief. Next slide, sir. Nidan Parivarjan means curative measures. Nidan Parivarjan means to avoid etiological factor. Preventive measures, sorry. This stop the further progression of the disease by restricting vitation of dosa. Viruddhahar and Mithyahar Vihara are stated as a main etiological factor of Kushta Roga, so they should be avoided. Next, sir. Conclusion. In the contemporary view of the Vicharchika, it can be included as eczema. Long period of treatment in form of suppressive and symptomatic, topical and systemic are necessary in both therapies. In Ayurveda, Kushta and Sudra Kushta are broad concepts with pointed principle of the management. All aspects of treatment also described in Vicharchika, example Patya and Apatya diet. Various drugs for systemic and local purpose in many form of the drug preparation, lepas, rasayana preparation, oil, cod, decoction, etc. Special modalities for biopurification, means panchakarma, are also described. It means Ayurvedic management will be effective and the acceptable treatment in skin disease, especially in eczema. Next, sir. These are the references, and thank you for the attention. Thank you, sir.
Thank you, doctor. I think today's presentations seems to be over. I would like to invite Dr. Aishwarya RS for concluding the session. And thank you for the presentation.